So what you can say is that you can only apologize, and after that, you can tell him that maybe he's not also part of our medical team, because you know maybe he has approached a different consultant, or maybe he has approached someone else. But if he tells you, doctor, I know that he's from your medical team because I saw him attending my mother. Now you can tell him that
Yeah.
sometimes we are working with many patients and we don't have time to explain everything at every time, especially during the ward round. And that's why it's advisable also to take an appointment to talk to the doctor. However, this is not an excuse. And I will definitely talk to him to find out what happened. Okay? Which means that maybe he's approached the consultant in the wrong time.
Yeah, yeah.
Okay. Last thing, actually, you insisted on the hematuria. I told you that in the middle of my talk, I told you she has got some procedure to widen her blood vessel. Yet you were speaking about the hematuria. I was not interested in the hematuria. I was only interested in the PCI itself and the nurse behavior. So you first attend the nurse behavior, and in the end, he will give you the hematuria concern. He will tell you, I noticed some blood in her urine. When he asks you what is the cause of the blood in her urine, what you will say, Dr. Zaid?
Well, honestly, we have done several urine tests and blood tests, and we haven't so far we haven't found the real cause for the body urine.
Okay, why didn't you say this?
And I think I said that we should do sometimes because of the catheter, and the catheter got irritated to the bladder. And
exactly. Yeah. Why didn't you explain first, saying that we did many tests, but all of them came back normal? Then when he asks you, why could it be, you can say that it's a complication. It's going to be a complication of the question.
Okay.
Okay, Dr. Zaid. Dr. Zaid, you have to see the chance. How, if there's any point or piece of information given to you in the task, please use them.
Okay. So what do you mean? What do you mean by that in the task?
Because in the task it is said that many investigations have been done and they came normal.
Yes.
So at least mention it to the patient to show them that you have done something.
Oh, okay.
When any patient in PLAB2 asks you, what are you going to do right now? What you can do? This means that he needs you to tell him the full plan. So tell him that we already have done some things. These solutions or this point can absorb his anger, to show him that you are working with these things and you already worked in them and started working with them. So he tells you, what have you done for this? You will tell him that we have done some blood tests and some urine tests to find out the cause, and all of them came back normal. Why I'm saying this, Dr. Zaid? Because it's mentioned in the task. Do not ever do not ever overlook any piece of information given to you in the task. And in the end, this was a strange question. Like she's eating or feeding when some nurses are around, and she's not feeding with other nurses. Do you know the reason for that?
No, I don't know. Actually,
okay, so what you can say?
So I said that my apologies for that. I apologize for that, and I will go to the head nurse and speak with her about this incident.
That's perfect. Perfect. This is what I need from you. So in PLAB2, if you do not know everything, or if you do not, if you are not aware about what happened or the incident, please always talk. Talk to them to find out what happened and come back.
Okay.
This is the station so far. This is an easy station and very easy one, by the way. But the problem, by the way, you said something in the middle which I forgot to write. But you know, I was shocked in it. I'm trying to remember it actually, but I don't remember. When you said about the consultant, I think. When you said about because you know
actually,
yeah.
I tried to speak. I spoke a lot. I found myself. Yeah. So I tried to speak less in this.
This is very good if you speak less. Dr. Nigar, this is the station of the angry son who's coming to visit his mother after the PCI. The mother was having hematuria. Dr. Zaid, you were not speaking too much, but I thought that you could be a little bit clumsy or anxious when you are expressing yourself at some point when you are losing track. I have a good idea. I need someone of you, maybe after the break or after the session anyway, someone of you to prepare for me one station, and this one will be my patient, and I'll be the doctor. I need anyone to pick for me any angry patient station, and they will see how I'm going to practice it. And please be very tough to me. Be very tough and reluctant. Who is ready to do this? I need someone who's really stubborn, someone who's going to give me, okay, Dr. Messi, that's good. So I need you to learn one task, and please try to give me very tough time in it, so that the other people will see that how I'm going to practice it and how I'm going to observe you. Uh, this way, you are going to learn how to approach, yes, angry patient, definitely. Angry patient. This way, you will learn how to act and be calm in front of any angry patient. But do not ask some things which are very far away from the task, okay? Okay. So, Dr. Zaid, this station can be finished in 5 minutes or 6 minutes. You did a good job in the time management, but the only problem, and you even asked, by the way, one last thing. When the patient is pushing you towards the same concern twice, for example, I pushed you once. Tell me what happened. Now you can tell me, okay, I need to ask further questions. But if I pushed you twice, I mean like one more time, no, now you have to move to the concern. Did you get my point? For example, if I'm coming to a result and you are still asking me, or you are telling me that I'm going to ask you, I will tell you, okay, ask me, doctor. But in the middle, if I get bored and I tell you, doctor, tell me please about the result now. So this is the second time the patient is asking from you. The second time means that you should move to the concern right now. First time you can keep asking him. Second time you should move to the concern.
Yeah, true.
Otherwise,
so what about what about at the end when you said me you can take a history? So actually, I get confused.
No, actually, you know, you finished your task. You did everything good. You address the patient concern, and you have more time. Why don't you take a little bit more history? Like, for example, apart from that, does you have any other medical condition? Would you like any other help? Like this, you know, like simple chat, which is not harmful, of course, because your task is done. Okay? So I do not want you to ask like full chat, full history. No, I just need you to ask 2 or 3 simple questions. Okay, Dr. Zaid? Was it clear? Was it clear?
Yeah, thank you.
Okay, perfect. So let's move to another angry patient station. This station actually is easy as well. The second station is the father who's coming because his child was diagnosed with I mean he was having like some twists on his ankle, and he came here because the bruise or the swelling of the ankle did not disappear. So this father actually is here because he has some concerns. The task here says that you are Fy2 working in surgery department. The patient is a 14 years old boy with cerebral palsy. His name was Albert. He came here because he has twisted his ankle. He fell from the wheelchair. Your colleague has examined the boy, and he didn't find any bony tenderness, just swelling and bruise. So no bony tenderness. No bony tenderness. No bony tenderness. Why I'm stressing on it? Because this is very helpful right now. So the father is here to talk to you about some few things, and he has got some concerns. Especially note the father is angry. Now you will enter the cubicle. You will greet yourself and introduce yourself to the father. How can I help you, doctor? I'm having some concerns. You will ask him what's your concern. He will tell you, doctor, I just need to know why didn't you or why did you treat my son like this? I'm not happy with my son's treatment. His name was Collins, I think. His name is Collins, not Albert. So I am not happy with Collins' treatment. May I know why I'm not happy? Because when he came here 2 days ago, you just gave him some painkillers and discharged him, and your colleague was not even informed. He didn't tell us for how long should we take the painkillers. He didn't do anything else. Okay, now tell him I'm so sorry for your experience, but please may I ask you a few questions if you don't mind to know more about his condition? Yes, doctor, ask me. Okay, now, again, the reason for the visit. Number one, ask him why did he come. Number two, how is he feeling right now? What about the pain? What about the swelling? What about the bruise? Did they change? Actually, his bruise and swelling are still here, doctor, but they just reduced in size. Okay, that's good. Does he have anything else? No, doctor. Let's speak about his medical history or his general health. Has this ever happened to him before? How was his health recently? Does he have any medical condition? He will tell you, yes, doctor, he is having cerebral palsy. I'm sorry for that. And how has this affected his life? He will tell you that he is on the wheelchair all the time and he is not that movable. So now you know that columns is not movable or not active, not physically active. Okay. And does he have any other medical condition? No. Does he take any medications? No. Now ask about the family history. No need actually to ask about the family history because he's the child. Just ask about the birth questions. How was his birth? Is he up to date with the jabs? Are you happy with the red book? What about his diet? Please mark that here you have to stress on the social history. You have to ask about who takes care of him. Why? Because this could be an accidental injury. So in this case, you have to ask about who takes care of him. He will tell you, yes, doctor, I'm taking care of him all the time. I'm the only carer for him. And how do you cope with that? He will tell you, doctor, I send him to nursery school because I'm doing some part-time job. His mother died like 7 months or 8 months ago. You can ask these questions to know that maybe to ask about the reason for the cerebral palsy, to know what happened exactly. It's fine. Till 15 years old, they are still child. No, I think he was 12 years old, not 14. I'm sorry. But it's just, you have to ask a little bit of this. Only ask him how was his birth, what was the mood of delivery, like this. Because this is like neurological problem and it could be due to something in the birth itself. Um, anyway, he usually will not let you complete your history, so that I'm stressing on the fact that you have to take some social history from him. Okay. What after that he will tell you, doctor, so tell me now why did he do this to my son? Again, you apologize again. That I don't know actually what happened, but I'm definitely going to talk to him to find out what happened, and definitely I'll come back to you. And definitely I'll let him come and explain himself to you as well. But doctor, he was not informative. He didn't tell me even for how long should we take the painkiller. Well, you tell him that I'm so sorry for that again, but usually we prescribe the painkillers for the first few days regularly, and after that, when the pain is eased, you can take them or he can take them only when needed. Okay, doctor, but doctor, I'm not happy really. May I know why? Doctor, he didn't do anything else. So, see, he told me that he didn't do anything else. This means that he at least had some other expectations. You can ask him, may I know what you're expecting? Doctor, I don't know. He should have at least done some x-ray. So may I know why you think x-ray was helpful here? Because doctor, he could be having fracture. See, you have to ask why all the time in ethics, and that's why I stressed on that. This guy is expecting x-ray because he thinks that his little son is having fracture. And here the task says that there is no bony tenderness. Bony tenderness means fracture or possibility of fracture. But if there is no bony tenderness, this means that there is no possibility of fracture. So you will tell him that actually my colleague has examined him and he found that there is no tenderness or no pain on pressing the bone, which means that the possibility of fracture is unlikely. Oh, doctor, so what if it's not fracture, what it could be? Now you can tell him that it could be something we call ankle sprain. And ankle sprain is a condition which is with an over twist or like weakness in the ligament which is supporting the joint. And this usually happens due to the twist of the ankle of your son. Okay, doctor, but what are you going to do for him? Simply you will tell him that this usually eats on its own. Why it eats on its own? Because usually this is like soft tissue injury. Soft tissue injury just needs some rest, okay, and needs some analgesics like painkillers and some like ice packs, like any soft tissue injury actually. You will treat it as any soft tissue injury. Okay, okay. This is the station so far. This is a very easy station, and it doesn't need anything more. And actually here, there is no need to do instant form nor such things, because this is not medical error at all. This is not like your colleague has not done something bad. Your colleague actually, maybe he could be, or he could have been very fast, but he didn't do anything bad. Okay, so this is a station. Very easy and can be done in 5 or 6 minutes. Oh, this is a good point. Dr. Manisha, you can also say that we may need to examine him, but uh, the examiner will tell you, doctor, no need to do examination. Or he will tell you, doctor, the bruise, there is still bruise, but it has reduced in size. So if the examiner tells you so, one more thing as well, I forgot to tell you that what will be done here. If the father told you that what can be done, you can simply tell him that it's usually eases on its own. Usually the bruise will take a few days, like for example, it will change in color till it disappears. And reassure him that the swelling and the bruise usually take a little bit time. But the more important thing is that you told me that your son is getting better. This means that it just give him some more time to get better. This is what we expect, or this is what is important in this station. Very short station. He is angry only for one reason, because he did not do X-ray and your colleague was not informative. You address that. This means that you already passed this station. Okay, let's move to another station, which is one more angry patient as well. Okay, what is the angry patient? The angry patient here is the one who is having some fight with the physiotherapist. She was admitted here in the hospital a few days as well after heart attack, and after heart attack for which she undergone open heart surgery. And your colleague physiotherapist Sarah has advised her to move, but the lady does not want to move at all. So talk to the lady and address her concern. Official note, she is very angry. So now she's angry again. Why she's angry? Because of the physiotherapist Sarah behavior, and we will see that right now. So you will enter and you will greet yourself. How can I help you today? Doctor, I'm really concerned. I'm really angry with what happened. So tell her that I definitely I can help you and address all your concerns. I can see that you are quite frustrated. Can you tell me what happened exactly? She will tell you the story. What is the story? Yes, the story is that actually your colleague, the physiotherapist, has advised her to move. Okay, and she is not willing to move. So if she is not willing to move, this means that she has got some point in that. May I know why? First of all, you were admitted in the hospital. When you ask her why you were admitted in the hospital, she will tell you the full story, that the heart surgery and everything. She is very talkative lady, by the way. Okay, thank you for that. And how are you doing right now? So number one, the reason for the visit, or the reason for the admission. Number two, actually, you will ask her, how are you feeling right now? How are you feeling right now is very important as well. How are you feeling right now to assess your current condition? Okay? Okay. So number three, now take some history from here if you ever have time, because she will likely to push you towards the concern, like the medical conditions and such things. Number four, address her concern. You will tell her, she will tell you, she will now tell you, so doctor, tell me, I need to know why she did this to me. Why she was speaking to me like this. She was speaking very rude to me. She was advising me like if I am like, she was very bad to me. I don't know why. So actually, you will keep. Dr. Zaid, do you know why she did this to her?
She misunderstood. I know about the history. I know about this case. She misunderstood the nurse and the physiotherapist asked her to move to walk.
Yeah. Okay.
So
No, I'm just saying that. I'm just saying. Do you know? Do you know why your nurse, your physiotherapist colleague has talked to her in a rude way? You know why?
no, you know.
So what do you say?
Well, I'm sorry for this experience happening to you. So I will go to the nurse and speak with him,
Not nurse,
uh,
physiotherapist.
with the social service. No, with the physiotherapist.
Physiotherapist.
Physiotherapist. Yes.
Yeah.
Yeah. So I will
Oh,
reply to her like this. Yeah, I will reply to her like this one. Okay.
okay, perfect. So you will know that I don't know actually what happened, but definitely I'm going to talk to her to find out what happened, and definitely I will address your concern. Okay? So what to be done right now? Right now, she will tell you, doctor, but why did she advise me to walk? Why she wants me to walk? What you will say? You know, you don't have anything to say right now. You just say that actually what she advised you was for your benefit or for your sake. My sake, why, doctor? Because actually walking after the operation, such operation will improve your health and will improve you get better even faster. Remember, number one, we explain the benefits. Number two, we can explain the complications. But doctor, you tell me that it improves my health. Your nurse colleague has told me that I shouldn't walk. Oh, now comes a problem. Nurse colleague told her shouldn't walk. You think when this has happened, Dr. Zaid? He advised her not to walk. When was that?
Well, the problem I know about this one, the case, but sometimes I get stuck with this one. The nurse
when
advised her
she was
not to
just
walk.
admitted in the hospital.
Yeah,
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 exactly. So now,
yeah.
guys, usually the nurses advised her just when she first came in the hospital. This was because she was not improving. Yes, the first days, so she was not yet improving, which means that walking or any physical activity can exert her heart more or can exhaust her heart more. Okay, so now we will tell her simply that this was because you first came. This was before the operation. Your condition was not stable, and any further physical activity could harm you. Oh, doctor, but why didn't you tell me like this, doctor? Apologize again. Apologize again. Definitely this shouldn't have happened. I'm definitely going to talk to her to find out what happened, and I will come back to you. Okay, doctor. So you are telling me that walking will not harm my heart at this point? You will tell her that simply we can start gradually. We are going to start gradually, and we will not exert you or not exhaust you at all. Okay? And we are going also to start with simple walks around the corner, and gradually will increase the pace. Okay, doctor. But what if my heart was harmed by this? Or what if it caused some problems to my heart? Now, what you are going to do, you are going to tell her that actually the heart is the strongest muscle in the body, and believe me, that walking or any simple physical activity at this point will improve its efficiency back again. So, doctor, when can I resume my normal activity? You're telling me that you're going to start slowly and you'll increase the pace. You're going to tell her that we need to do some tests for you to check your improvement, after which we are going to assess your ability to do physical exercises. Like we're going to do treadmill stress tests, the stress test to see how your heart, how your heart is responding, or how your heart is coping and improving. And after which we can gradually increase your physical activity in a way that responds or in a way that improves your heart. Okay, doctor, thank you. You have been very helpful. So number one, you will apologize for the physiotherapist's behavior. Number two, you explain why the nurses have explained this to her or have advised her not to walk before the operation. Number three are going to reassure her that we are going to start simply and gradually till she improves. Number four, reassure her that we'll never harm the heart because we will do gradually and we will assess her heart by treatment stress tests from time to time to see the ability of the heart to to see the improvement in the function of the heart. In the end, she will ask you one question, Doctor, so do you think really walking has been helpful? You will tell her that I can see that you're quite worried, but actually, beside improving your health, also walking prevents some further complications from happening. Which complication? Now we can speak about the DVT and pulmonary embolism. Like staying immobile for long can cause some blood clots to develop inside your blood vessel in the leg, and this can cause some blood clot in the lung. And we don't want this to happen to you, so that we advise all our patients to have even simple walks after such procedures. Okay, doctor. Okay, seems that you're right. You have been very helpful today. Thank you, doctor. Thank you. This is the whole station, and this is another very short station as well. Usually, these stations, when they come, they are like a gift. Why? Because you can finish everything in 4 minutes or 5 minutes. So if you still have time, you can take some history from here. Like, for example, and do you have any other medical condition apart from what you told me? Okay. So now you will take some history from him. Sorry, you will take some history from here and like be concise history, like 1 or 2 minutes history. Even 1 minute history is very enough. Okay. So let's move to another station, which is the herbal remedies. The herbal remedy station is, I don't know why many people are confused in it, and it's a little bit high yield sales station. But don't worry, actually, you give him the approach, how to approach it, and know how to ask her and how to elaborate her concern and how to address her concern. Okay, in this station, simply what you can do here. Number one, the task says that you're FY2 working in pediatrics department, right? The patient is a little bit, the patient actually is a little, the patient is a child, 5 years old. He has been admitted in the hospital a few days ago because of chest infection, and he has been transferred to the NICU, NICU. His mother, your nurse colleagues have noted that his mother have been giving him some green juice. Your nurse colleague have been a little bit concerned about that, and they wanted you to talk to the mother about it. Talk to the mother, bring the matter to her, and address her concern. Special note, none. Special note, none. Okay, now you will enter the cubicle. You will ask the mother. It's very good always to start by taking some history. How to start by taking some history. For example, you will ask the mother, how can I help you today? She will tell you, doctor, I'm here because I have been told that you are going to talk to me right now. Okay. So, yes, that's right. I'm going to talk to you. But can you tell me, can we go through what happened again? Why was your little one admitted to the hospital? Oh, doctor, he has been admitted because he has been having chest infection. He has been coughing and having fever in the past few days. And that's why, doctor, I thought that he should come here. And I brought him here. They told me that his condition is a little bit over or a little bit strong. That's why actually they kept him here and they started giving him IV antibiotics. Okay, doctor. Okay, sorry. You will ask her, for example, and how is he feeling right now? How is he feeling right now? Actually, he is improving a little bit. His condition is improving. And what's he receiving? He is receiving, doctor, some antibiotics IV. Does he take them regularly? Yes. Like number one, reason for admission. Number two, current condition. And number three, right now, we'll ask about some medical history. Okay, apart from that, has he had a similar episodes in the past? Sure, 3 years, doctor. He's been having some many episodes of chest infection. This seems to be quite frustrating. And what was done? Now you will tell her, she will tell you, doctor, actually he's been having the chest infections every time, and that's why we come to the hospital many times, doctor, because he's having neuroblastoma. Okay, ask her when was the neuroblastoma diagnosed and how is it managed. She will tell you, doctor, actually it is managed on some chemotherapy sessions. Okay, so now you know that he's been having neuroblastoma. Tell her, by any chance, you told me that he's been receiving chemotherapy and antibiotics. By any chance, does he take any other medications? She will tell you no. She will not open up about the herbal remedies right now. Okay, ask her some questions from the birth, jabs, red book, and diet. Okay, so number two, you will open up to her and you will tell her, thank you for understanding and talking to me. Actually, I wanted to talk to you because I have got some concerns. What's your concerns, doctor? You will tell her that my nurse colleagues have noticed that you have been giving your little one some green juice. Is that right? She will tell you, yes, doctor. Ask her, may I know what is this? She'll tell you, doctor, it's just a herbal remedy. What's the problem with that? I can see that you're quite concerned. May I know if you know its content? She will tell you, should I? You will tell her, actually, yes, you should know its content because some of these remedies can interact with the drugs we are giving to your little one. Oh, doctors are always like this. You always exaggerate and you always like you always like, oh, you guys, you never accept any other opinion except yours. You will tell her, I'm sorry if I give you this impression, but the thing is that these remedies can sometimes contain some substance which can interact with many drugs. And you told me that your little one has been receiving antibiotics and chemotherapy as well. So don't you think that these things can interact with what your son is receiving? Especially his immunity is weakened, or he is vulnerable. So tell you, no, doctor, actually it has been helping him to improve. You are mistaken, doctor. So, number one, ask her about the content. Number two, tell her about the drug interaction. Number three, she told you that he is improving. May I know why you think so? She will tell you, doctor, he's improving, doctor, since I started giving him these antibiotics, these remedies. You will tell her now, may I know since when have you been giving him these remedies? She will tell you, doctor, actually, I have been giving him these remedies since maybe 4 days. So usually she will give you that she's giving the remedies since the start of the antibiotics. I mean, the start of the remedies matches the start of the antibiotics. The start of the remedies matches the start of the antibiotics. So now you can tell her, don't you think that he could be improving because of the antibiotics we are giving to him? She will look concerned. She will tell you, doctor, but it's not only him. Actually, it has helped also my cousin. May I know what happened, or for example, what was your cousin's case? She will tell you that she was having sometimes like some tummy pain. And how old is she? She is 30 something years old. So, well, the thing is that actually these herb remedies are not designated for each disease or for every disease. They are only designated for the disease which can be managed simply, even without drugs. And one more thing, they don't work on everyone. What fits or what works on your cousin may not work on you regarding these remedies. And I'm sure you agree with me that your little one is already weakened by the drugs he's taking. So it does not suit him. Oh, doctor, I'm not like convincing with this. Okay, just I can see that you're quite concerned about that, but I just need to ask you about one thing. Maybe you get more like oriented about it or you understand it better. Okay, tell me, doctor. Do you know from where did your cousin get it? She will tell you that my cousin doctor has got it from outside UK, or from, for example, from China, from anywhere. Now we will tell her that actually, these remedies are not all the remedies are licensed to be used in UK. Do you know why? Why, doctor? Because some of them, their content do not match the license or do not match the quality of UK products. I mean, not all of them are accepted or licensed to be used in UK. Oh, doctor, so now even you're telling me that it differs from the ones who are licensed in the UK and the ones are outside UK? Well, actually, the thing is that we usually, in UK, we investigate and we examine their contents in a way that that suits our patients or suits the people here, because we never accept such risks. I mean, we never accept some risky products to enter the market because it can have some implications on our patients. So now you will ask here about either it's from inside or outside UK. Why it's important? Yeah, it's important because not all the herbal remedies are licensed to be used in UK. And how do I know, doctor, if it's licensed to be used in UK or not? You will tell her that there is a label called THR, Traditional Herbal Registration. Is this label, if it's over the product, this means that it's licensed to be used in UK. Okay, doctor. But still, doctor, I'm not convinced about what you said. Really. Now you tell her that actually I'm talking to you just because I know that you're concerned about your baby health or your little one health, and we are also concerned about that. So we wanted actually to advise you to prevent any implications or any complications to happen for him. And I'm sure you don't want this to happen to him. Okay, doctor, but still, I believe that it's improving him. Now this mother is actually not convinced, and you need to stop this medication. Why? You yourself need to stop this medication because it's imposing some threat and some danger to the baby health or to the child health. So definitely you're going to arrange for her a meeting with a senior to talk to her about that because this must be stopped. So if you as FY2 fail in convincing her, please arrange a meeting with the senior because he's going to have a talk to her. So let's sum it up again. Number one, you'll bring the matter. She's not convinced. Number two, ask her about the content. She doesn't know the content. Why, doctor, the content is important? Because of interaction. It may interact with other drugs and enhance their side effects or enhance their effect themselves, which can be risky to your little one. This is in terms of the content. She will tell you, doctor, but it's helping him to improve. Now ask her, since when have you started giving it to him? And she usually will tell you since a few days. Then tell her, don't you think it could be because the antibiotics is improving? She will tell you, could be, doctor, but I think it's helping him more. Okay, actually, these medications are designated for individual use, and they do not work in every disease and not in every patient. May I know from where did you get it? She will tell you from my cousin. How old is she and what was her condition? She is old and her not old like young age, middle age, and her condition is a little bit simple, like tummy pain or something. So you will tell her that it does not work on every person, and it does not work in every disease, and also as well, actually, your little one is a little bit, his immunity is weakened, and such things which you are not sure about can harm him even more. Okay, now we speak about inside or outside UK. Why? Quality product. Outside UK are not licensed to be used in UK. And how can I know this? From THR, the label. Okay, now move to the last point. Actually, she is not convinced. Now tell her that we are convincing you or advising you for the sake of your son. We need his better even as you do, or we need his sake. We need him to improve. I'm sure you want him to improve. Um, Doctor, I don't think so. So now we will arrange her a meeting with the senior. Why? Because she must stop it. But as if Y2, your mission is done. You failed to convince her. So now your senior consultant will convince her because this poses a risk to the little one's health. This is the station so far of the herbal remedies. Why do people do not pass the station? Okay, you do not pass it actually because number one, you do not ask about the content and speak about side effects. You just go lightly, you just go directly. You have been giving him this and it doesn't work. Actually, I'm afraid that it's not the right thing to do. No, bring here, like for example, ask him to know about the content. For example, how they work? Since when have you been giving it to him? One more question you can add as well. If she has asked for any medical help or seek any medical advice before giving it to him, definitely she will tell you no. Why should I? If she tells you like doctor, why should I doctor? Now you can also ask her or tell her that actually some of its contents can interact with the drugs we are giving you. So ask about the content. People forget to ask about the content, which is very important. Number two, how often or since when have you been giving it to him? Why? Because to see since when it started, because actually to compare it with other drugs. Number three, you should ask her from where did she get it. She'll usually tell you that it has been helping her cousin. So tell her that your cousin is older and her condition is simple. Also, your baby or your little one is compromised, which means that such simple things can even harm him more than anyone else. Okay, people keep justifying themselves, but they do not ask the patient such questions that we told. Okay, okay. So this is the station so far of the herbal remedies. Can you give me 2 minutes, guys? 2 minutes, I'll be back. Hello, everyone. I'm sorry for the delay. So, now some people, wait, let me check the messages. Uh, so, let's back again to the stations. Are you all here? Everyone is here? Everyone is listening? Okay, 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 good. So, let's move to the next station. Next station is wrong diagnosed pneumonia. The guy has problem. What is the problem? The problem is that he came 2 days ago and he had X-ray, and in this X-ray, the your colleague told him that he's having pneumonia, and he started giving him antibiotics accordingly. So here he has been given antibiotics unnecessarily. This is not a medical error in which there is misdiagnosed. No, it is actually wrong diagnosed. What happened exactly? Your colleague your colleague has mixed the X-rays. For example, instead of writing that Masih, God forbid, that Masih got pneumonia, he just wrote that Ahmad got pneumonia. And actually, Masih was having pneumonia, but Ahmad was absolutely fine. So the X-rays were mixed, which means that he has been given antibiotics unnecessarily. So now you will disclose the medical error to the guy. What you are going to say? You're going to tell the guy that the reason for the visit, number one. Number two, I mean, like, why did he come 2 days ago? And how is he feeling right now? How is his cough, his shortness of breath? He's absolutely fine right now. Take some history from him again. So number one, reason for visit. Number two, current condition. Number three, very well or very important, medical history. Here you can ask also about the complications. Like, for example, did he develop any rash in the body, any shyness to the light, any discharge from the ear, like the otitis media and pneumonia complication or meningitis. Just ask him these questions, like number one, reason for visit, number two, current condition, number three, if he developed any complications or not. Take some medical history from him, like very short, concise one, and ask about lifestyle as well, just to gain data gathering. Now move to the disclosure. You will tell him actually you have been diagnosed with pneumonia, right? And by the way, one important thing, he will tell you that I was given antibiotics, doctor. Now tell him how many or how did you use the antibiotics regularly? Did they help you to improve? He will tell you yes, doctor. So you will ask about the reason for visit. Number two, the current condition, and if he took the antibiotics regularly or not. Why? Because he was prescribed the antibiotics unnecessarily. Number three, if he developed any complications or not. Number four, past medical history. Number five, disclose. You will tell him actually your X-ray uh, has been mixed. What does it mean, doctor? You will tell him that you were not having pneumonia. Your X-ray was mixed with someone else. He may ask this silly question, you mean that my X-ray has been lost? Actually, it was not being lost. It was just mixed with someone else. And how did you find that? We find this by going through your record back again. When we went through your record back again, we find that your X-ray was normal. How could this happen, doctor? You will apologize. This shouldn't have happened. I'll definitely talk to my colleague to find out what happened, and I will come back to you. Doctor, so what's next? Actually, you took the antibiotics unnecessarily, I'm afraid. That's why we are going to review you again. I'm going to examine you again, and we may need to stop your antibiotic. Doctor, is antibiotic harmful? You will tell him, usually, actually, in your case, you did not develop any problem. However, sometimes it can be harmful. It can develop resistance in the long run and diarrhea. Diarrhea, which is the CDAD, Clostridium difficile. Just say resistance or diarrhea. So if you develop any diarrhea in the next 2 months, come back to us. Okay, doctor. So what's next? Doctor, I'm not happy. Does it happen a lot in your hospital? Now you will fill incident form. Doctor, please, I need to complain. False. So again, the whole station is about only one thing. It's about disclosure and apology, and telling him that the sample or the X-ray has been mixed, which means that instead of giving his antibiotic to someone else, you give it to him. So you need to warn him about side effects of the antibiotic in case he develops any of them in the future. Okay, okay. I think it's very clear station. Does anyone has any have any problem with it? Dr. Maria, are you following? How? Tell me how. He was least interested how? Yeah, actually, he can be less interested. It happens. But yeah, tell me.
Yeah, what you asked me, like how am I liking it?
I asked him the reason.
Wait, Dr. Maria, wait, hold on for a moment. Tell me, Dr. Masih, what happened? Tell me.
When I entered the station, I asked him the reason behind his visit. He told me that doctor, I came here for a review and all. Then I assessed his present condition. How is he feeling at the moment? I asked him about the symptoms of pneumonia. Do you have any cough, shortness of breath, or chest pain? I forgot to ask about the meningitis. And then after assessing his present condition, I asked him that why did you come to the hospital before? Then that I was come here and I was diagnosed with pneumonia. Okay, then I said, all right. So do you know why I'm here? I need to talk to you something about an error that has been made in your medical management, a couple of days ago when you came. So he told,
I think your
what
voice is
doctor?
interrupting. Your
Then I
voice is
told him
interrupting.
it was with someone else.
Okay, keep going. Yeah.
Okay, I told you last time your report was mixed with someone else, and you were misdiagnosed with pneumonia. And fortunately, you didn't have anything. So he said, "What?" And I told him that you didn't have any. My colleague has read the report of someone else and diagnosed. However, you didn't have anything at all. So, okay, doctor. And I said, I just wanted to make sure that you're fine. If anything else. So then he said that, doctor, I was prescribed some medicine for that.
Your voice is interrupting. Your voice.
I was given antibiotics, and I asked him, did you take the antibiotics as prescribed?
Yeah. I think Dr. Maria, it's from his side. Dr. Masih, your voice is interrupting.
Is it? Hello?
Yeah. Tell me.
Hello?
Yeah.
Yeah. So I asked him, did you take the antibiotics as been prescribed? Then he said, yes, doctor. Then I said, did you develop any kind of side effects of that? Then he said, yes, doctor. Told you
Yes.
about, I think, diarrhea.
He developed
Then I said,
diarrhea.
oh, yeah. Then I said, okay, I'm gonna look into that. So then after that, he said to me, doctor, like, does this usually happen in your hospital?
Yeah. Incident form.
Then I said about this incident form and that board meeting and all that. And he didn't ask me about this complaint issue, that pulse one.
No, it's fine. If he did not ask, it's fine. You shouldn't bring.
But he was, with his expressions and his facial expression, he was less interested in what I had to say.
Why?
The same thing happened to a friend of mine also. I don't know. We both failed this section.
Oh, you know what? This means that, actually, because actually this happened to me in my exam as well in my first attempt. and it was the lady who's having the son with amoxicillin rash, the one who developed rash after.
Okay.
Dr. Nigar, can you hear now? So this is the lady who developed, whose son developed amoxicillin, rash after amoxicillin. She was very least interested, but it was my duty or my mission to bring her back on the track. So I told her, I kept taking some history from her and trying to involve her all the time, but seeing that she was really sleepy. I mean, I'm not kidding. The simulator was really sleepy, and maybe she would just wanted, she was just
Maybe
interested. Yes.
maybe I should have asked that guy that I'm sorry to say this, but I think you're least interested in what I had to say.
No,
Is there
no, no,
anything
no,
else?
no, no, no. Don't say this. No,
Huh?
just simply say that. I can see that you are quite a bit annoyed. Anything annoyed you, or anything is annoying you? Anything is bothering you? Like this.
But seriously, he was least interested in what I had to say. He wasn't even, I would say, like he didn't give me a response or a reaction to what I was saying.
In this case, actually, you can ask them. I can see that you're quite annoyed. Is there anything bothering you? But in a
He
nice way.
wasn't even annoyed.
Huh?
He was really not interested.
Yeah, okay, you can tell him this. I can see that you are annoyed, or I can see that you are maybe.
I think it would be very. I'm sorry for interrupting.
No, it's fine.
It is very rude to say the way Messi was saying.
Which way?
Can you imagine?
You are not interested. Yeah.
Yes, yeah. It is rude. You can't say that. You say, I see that you are distracted with something. Is there something in your mind or something? I think like this way, just normal way.
Okay.
Yeah,
This happened to in one of my station as well, in which a patient was literally not interested in listening in my management, and he was yawning and even closing his eyes.
Yeah.
So I just asked, "Are you following me? And is there anything else you want to talk about? And like, do you have any concern?" But he said he's fine, and I got 4 in interpersonal. So they are meant to do this, I guess.
So wait, what did you say again? What did you say?
I said, "Are you following me?" Or I said that, "Do you have any concern?
Yeah.
Are you okay?"
Yeah.
Like these kind of stuff.
Yeah, exactly. So you can say that. Is there anything bothering you? Is anything like this?
Yeah, exactly.
So you can
and
always
I got 4.
yes, you can repeat. This is very good. You can repeat these things. They never harm. And actually, you'll be having time. So, Dr. Masih, actually, this is what you can do. We have nothing else to do.
Okay, brother.
Just it's your mission. I mean, okay, if he's bored, you can make him less bored. How to be energetic, and that's why, guys, I'm stressing on the fact that you need to be energetic, guys. If you are energetic, you are not giving the simulator the chance to take his breath. You're not giving him the chance to be bored and yawn. It's your mission, and you will see right now how I'm going to take history from someone in an angry patient. Okay? Okay. So, is there anyone, Dr. Nigar, can you hear me right now? Guys, is there any problem with my voice? Is it low? My voice is low? You know, when the voice is low, Dr. Nigar, it could be from your side as well. Okay. Okay. Absolutely. Thank you. Okay, so guys, let's move to the next stations, and from now we have to be a little bit faster. Actually, the next stations are a little bit easy as well, apart from 1 or 2 stations only. Let's start with your colleague. Okay. In your colleague, actually, there are 4 scenarios. Number one is the late colleague. Number 2, the alcohol colleague. Number 3, the cocaine colleague. We so far have discussed only 4 stations from today. So this means that we need to be faster, and we will need to cover at least 15 stations in the next 2 hours and a half. I think this is quite enough. We can do it. Okay. So in the late colleague, actually, you will enter. By the way, in the cases of the colleagues, I need you to write these. The most important thing in the cases of the colleague is to build a rapport. If you do not build a rapport with your colleague, you are in trouble. Because actually, you are not supposed to investigate him. You are just advising him. You should be very nice to your colleague. Otherwise, again, you are in trouble. Okay? So, in the late colleague, actually, it has been mentioned in the task that you're FY2, working in medicine department or surgery or whatever, and your colleague who's final year medical student, he is final year medical student. He comes back or he comes late to the hostel or to the ward round. Talk to the colleague to find out what happens and address his concern. He is FY1. Again, guys, he is FY1. He is FY1 for those for those who can forget it. Again, he is FY1. Please do not forget that, please. Okay. What is the difference between FY2 and FY1? FY2 can prescribe medications and can discharge patients, but the FY1 can only view patients, but cannot prescribe and cannot discharge. Okay. So, Tyron, his name is Tyron. You will enter, hello, I'm Dr. X, your FY2 colleague here. Are you Tyron? Can I confirm if you are Tyron? Yes, I'm Tyron. How are you today, Tyron? How is your work? How is the ward round is going to how the ward round is going today? Everything is fine. Would you need any help today? Do you have any patients waiting for you? No, doctor. Okay, thank you. We're going to have a little bit chat or a quick chat, and definitely after that you can go. Okay, that's all right, doctor. Doctor, why do you want to talk to me? Well, do you have any idea what I want to say? No, doctor, actually, you told me that you want to talk to me and I got a bit concerned. Well, actually, I'm just having some concerns regarding your arrival to the hospital. What happened, doctor? Actually, I have noticed that you have been coming late in the past few days. Doctor, it's not a big deal, just 5 to 10 minutes late. And it's not a big deal, doctor. Now, if you say something and he denies, you can say that also other people noticed it. Now he will be embarrassed. So tell him also our other colleagues confirm that you have been coming even more late. Doctor, I think it's not the case. Well, this changed recently. Changed because he was not having any reason to come late. He accepted it. When I told him, it happened to me. It came in my exam, by the way, in my like 2 months ago exam. He told me that, oh yes, doctor, I come late. So what's the problem? You will ask him, if there is any reason for you coming late. Okay, there can be many reasons. One reason is that he is staying late tonight. One other reason is that he is not interested to come early. So these are the two reasons, guys. He would tell you, doctor, I'm just not interested in coming early. May I know why? He would tell you, doctor, I'm in my final year. I need to take some rest before starting my medical job. This is one scenario. And the other scenario is that he can tell you, doctor, I just come late because I wake up. Maybe he will tell you, doctor, I just come late. That's it. So there could be many reasons for coming late. Number one, waking up late. Number two, being lazy. Those are the most important reasons for coming late even for any of us, even for me myself. Waking up late or being lazy. So put the two possibilities in the back of your mind and always keep them because it can change inside the cubicle at any time. Okay, so now ask him, may I know, where do you live? Doctor, I live like around maybe 20 minutes, 30 minutes away by bus from the hospital. Okay, that's great. So when do you wake up? He will tell you, doctor, I wake up maybe at 8:30 or 8:45. This is a little bit late. Do you know why do you wake up this late? He will tell you, doctor, nothing, doctor. I just go to bed a little bit late in the past few days. Me, I know why. Doctor, just I have been partying with my friends. So he wakes up late because he sleeps late because he's in party. So you to ask him, me, I know, let's speak about your lifestyle, or let's ask you a few questions regarding that. When you are in the party, do you drink? He will tell you, doctor, I'm a social drinker, and I'm sorry to ask you, but by any chance, any recreational drugs? By any chance, any recreational drugs? I tell you, no, never. Okay, that's great. So now we will tell him that it's very important that I'm sure you know that coming early or being in time is very important for us. Otherwise, it can affect your career when you start it soon. He will tell him what. He will tell you why. So now you start it first by taking some history of the incident, which is seeking information. After reassuring and building a good rapport, this is number one. Number two, you will tell him that it's harmful for his career. Dr. Nigar, it is the late colleague station. So, I'm sure you agree with me that this is not good for your career when you started. Why, doctor? It's not good. You will tell him that being punctual is one of the most important things about being a doctor. Otherwise, you would miss many things. Like what? Like many information in the word round. And consequently, when you start your career, it can be harmful to your patients. Why harmful? Because we miss many knowledge and many findings about their cases. Don't you think this can compromise our patient safety and treatment? Yes, doctor, that's right. So would you consider coming or being in time? Yes, doctor, I think it's a better idea. Okay, now ask him, this is seeking information, this is number one, okay? Number two, initiative, by asking him, would you consider coming early or being in time? Yes, doctor, I would consider. Number three, you will ask him or you will assess the patient safety. How to assess the patient safety? By asking him, have you seen any patients or are you aware about any incident which happened due to coming late today? No, doctor. Have you seen any patients today? No, doctor. Or maybe I have seen 2 patients. Okay. Then, here, when someone is coming late, you do not need to escalate to the senior. Unless it's quite repeated. For example, if he repeats it one more time, you will tell him, that's great, but I'm afraid that I need to tell you that if it's repeated one more time, or if it's repeated again, we need to involve our senior. Doctor, are you going to inform our senior consultant? Well, please do it right. I told you that we are not going to escalate or inform our senior unless it repeats again, because I'm afraid if it repeats again, it can affect some of our patients. And I'm sure we don't want anything to happen to our patients. Okay, doctor. Okay. I will be earlier. I will consider coming up earlier. Okay, that's great. Do you need any help with your ward round or with your study? No, doctor. How are your studies going? They are fine, doctor. Would you need any help even with the study? No. Okay, that's it. This is a station is very simple. The core of this station is to convince him that he's coming late. How to convince him? Number one, telling him that you have noticed it. Not only have noticed, but also other colleagues have noticed it. Now he will be embarrassed. Ask him about the reason of coming early. He may be reluctant. If anyone is reluctant, Dr. Elvira, what you will do? Dr. Elvira? Yeah, if he is reluctant, no, you can simply reassure him.
Yes. You mean if he's reluctant to come early?
Yeah. He's reluctant to open up.
Yeah.
So you will tell him that, Tyrone, please feel free to share anything with me.
Yeah. I'm here to help you, and I want to just get you out of trouble. I don't want you to get into trouble. So.
Perfect. Yes, if anyone is not opening up, please sympathy, empathy, and reassurance.
Maybe there
empathy.
is some particular reason for you being late.
Yes, exactly. And after that, you can ask him, is there any reason? Okay, you can mute yourself right now, if you wish. Okay, now reassure him, he will open up to you. Actually, or you can simply ask him 2 reasons for coming late. Number 1, being lazy. Number 2, waking up late. Let's ask about his waking up. He will ask about it, and then you will tell him that you need to be in time. Otherwise, no, you will tell him that this can cause some problems in his career. Why? Because being a doctor or being punctual is one of the important things about being a doctor. Otherwise, you would miss many things in the world around or the knowledge about the patient's health or patient condition. Okay, now you escalate to the, are you aware of any incidents that happened due to coming late, which is the patient safety? No, doctor. Okay, that's great. Also, one more thing, I'm afraid that if it repeats again, I may need to inform our senior consultant. And in the end, you will ask him, so do you need any other help? Do you have any other problem? No. So the rapport is the core of this station and reassurance. If you miss these 2 things, you will not gain any marks in the interpersonals and your colleague will give you a very tough time. Okay? Okay, Dr. Maria, no problem. Next station is the alcohol colleague. The alcohol colleague actually is the one, he's Fy2, and sometimes he is depressed. Wait, guys, wait a moment, wait. Hello? So, in the alcohol colleague, this guy is Fy2, he's not Fy1, okay? He is Fy2. And he has been, I mean, your nurse colleagues, you have noticed him, or your nurse colleagues have noticed his smelling of alcohol, and he's a little bit agitated in the ward round. Okay? Okay. So it's not only you who notices this, other people as well notice that he has been smelling alcohol. So right now, again, number 1, rapport. Number 2, bring the matter to him. He will be reluctant. He will not open up to you. Just reassure him. I'm here to help you. I'm here to support you. If you have any concern in your mind, or if you have any problem, please share it with me. He'll tell you, doctor, nothing. I just drink alcohol these days. May I know why? He will tell you, doctor, I just broke up with my girlfriend. I'm so sorry for that. And how are you coping with that? We are in alcohol colleague, the alcoholic colleague, Dr. Maria. So again, for this, actually, you need number 1 to seek information by asking why, and how are you coping with that? He will tell you, doctor, it's fine. I'm just a little bit feeling low in the past few days. So now you will ask him, we will tell him definitely we are going to support you with this. But may you tell me, when was the last time you took alcohol? He sometimes will tell you I took it like maybe in the morning, and some other times he can tell you that I took it in the midnight. But he smells alcohol right now. This means that he has drunk alcohol soon or recently. So tell him, by any chance, have you drunk alcohol in the morning? or have you drunk alcohol during the shift? He will tell you, no, doctor, I did not. So when you're seeking information, you have to ask about the reason for drinking alcohol and why or when was the last time he drank alcohol. And you can elaborate his alcohol habit to see if he is having an alcohol abuse or not. You know, for example, how much do you drink and since when have you been drinking, how often, like this, like this. This is not cage, like this is not abuse, but I mean just to see how much he drinks. And by any chance, any other any recreational drugs? No, doctor. Again, now you will tell him, I'm glad that you shared this with me because actually this can have some implications in your career. In case of alcohol, the implications is that you know, being agitated all the time or drinking too much alcohol can like affect his coordination and balance as well, which makes him like unaware about his decisions, or which makes him like maybe losing count many times. And this definitely can affect or compromise our patient's safety. Again, okay, doctor. So now you will ask him, have you seen any patients today? Have you discharged? Have you prescribed? He will tell you, no, doctor, or yes, doctor. If he tells you yes, this means that you are going to double check on his patients. You are going to double check on the patients. Doctor, are you double checking? No, just tell him I'm going to check the patients that you saw. I'm afraid. Doctor, are you double checking on me? Now you will tell him, please don't take it personally. The aim here is to ensure that all our patients were safe and nothing happened, because I'm here to support you and fix if there's anything which happened. Okay, doctor. So you are going to check on his patients. Number two, you are going to escalate to the senior. You are telling him, well, don't you think it's a better idea or it's a good idea to also involve our senior and tell him about that? He'll tell you, why, doctor? Why you want to involve our senior? Please don't take it personally again. You know, we are all working under his supervision and they deserve to know about everything. If some other people noticed it, so it's much better that you yourself go and tell him before it comes from any other person. So you are encouraging him to say before other person like snitch on him. After that, he will tell that this is very good actually. I'm glad for your understanding and sharing this with me. Actually, also our senior is going to have a talk to you, and they may do some tests to you to see how much alcohol or the effect of alcohol in your body. Okay, now this colleague is having, okay, you solved his alcohol problem and you ensure the patient safety, but still there's a problem. You did not ensure his own safety. You did not offer him a solution on how to tackle it. So you ensure the patient's safety and his attendance and such things, but you have to help him himself. So you offer him, you told me that you're feeling low and this is why you have been drinking on a higher side in the past few days. Yes, doctor, that's true. Well, I think you may need support. Don't you think that calling your GP would help you? Or talking to the occupational department can help you with that? Yes, sir. I'm going to consider that. That's great. And would you consider taking a leave as well? Yes, doctor. That's a pretty idea. Yes, I'm sure you need it these days. To like to clear your mind a little bit after this breakup. For example, in the end, you can also advise him on try to socialize, try to go out with your friends, or try to visit your family. Like this. Remember from yesterday, the one who was having bereavement. You are going to support them and advise them about to socialize. This is simply the station. Very easy station, but by the way, no. If he's a medical student, you would not ask him about have you prescribed anything or have you discharged any patient, okay? Because the medical students will not do this. The aim here is that, I mean, you are rechecking or you are double checking just to ensure that the patient's safety has not been compromised or no wrong decisions have been made by him. Okay. Next station is a cocaine colleague. Someone will practice it with me right now. I need someone to come and practice. Whose turn is this? Whose turn? Let me pick up someone. Dr. Muniba?
Hello. Yes.
Hello, Dr. Muniba. By the way, next one today will be Dr. No, not educational, occupational. Occupational is for the working people. Educational is for the people who are still in the study phase. Dr. Muniba right now, and the next one will be Dr. Islam. Okay. You will practice one station later, Dr. Islam. Okay, Dr. Muniba, can you turn on the camera?
Yes.
I am the cocaine colleague.
Okay.
Okay. Dr. Elvira, you are going to practice with me after the session, and you know this very well. I will not leave you. By the way, you can expect from me any question in the middle of the session about reassurance and sympathy and empathy. And by the way, in a while, I'm going to give you some question to ask me. Okay? Okay. The cocaine colleague, Dr. Muniba, you know this stat or not? You're FY2 working in surgery department. The patient is, your colleague, your FY2 colleague, his name, for example, is John. You have noticed that he has been a little bit agitated today, okay? And he has been feeling like so much agitated and anxious. And also you have noticed him in the party yesterday, he was sniffing cocaine, besides drinking too much alcohol. The problem is that your nurse colleagues as well have noticed him to be agitated in the ward round as well. So talk to him and address his concern. Okay. Dr. Zaid, what's wrong with the ethics? Okay, Dr. Zaid, let me point out few things or important things for you in the ethics. Speak less, be quiet, and reassure. Ethics are like art of convincing or skill of convincing. If you are convincing the one, or if you are like playing, like for example, convincing can take you body language and facial expressions, and also some little linguistic skills. This can help you definitely convince someone. Okay, but if you are telling the patient, for example, you should not come, if you are telling your colleague, but actually you should not come late, you know, because being late can affect your career. No, I just need you, but didn't you think coming late can sometimes affect your career? See, you are playing on a person. It's not about the exam. It's not about PLAB2 at all. It's just you need to convince someone by something. Maybe this one is really in his right. It's stubborn. I mean, apart from being a simulator, it is stubborn. So you need to. This is your mission because actually your colleagues will be like this at the NHS. So it's your mission to convince these people. Okay. Okay. Seriously. Like
I
for
didn't
example.
say that.
Yeah, no.
I
You just say,
that.
yeah. You said that, okay, we can talk about me after this conversation. No, you can simply pray it. Please don't take it personally. Please don't take it personally. We are not here to discuss personal issues. We are here actually because I'm concerned about you, about your career. You know how could this affect your career? Play it in a smart way.
Right.
In PLAB2, guys, if someone is not convinced, you reassure and sympathy. And the empathy or reassure is very enough here in this case. And still, you can tell them that we are doing this for you, for your better or for your sake. We are not doing this to judge you. This way, they will definitely submit, and definitely they will accept your offer. Dr. Muniba, you were very good in this station, seriously. But if you had a few more seconds, you would speak about the driving, you know, because it's unsafe for him to drive back home. And as well, the alcohol guy, it's unsafe for him to drive back home. Both people.
I have a question.
Yeah, sure.
Hello.
Yeah.
In the spice thing, when I was initiating the colleague that don't you think it would affect your performance and this and that, and so he was like you weren't convinced. Or were you?
Okay. This is one point actually. I was not convinced because I was about to come to this. The point is that when I'm not convinced, I told you, but I'm fine right now. You will tell him that actually its effect is more obvious in the long run. Because you know when its effect wears off, usually you will start having some other symptoms, like you will be depressed or you will be not concentrating, and that's why you will tend to take them more. You know, like any substance abuse, definitely when their effect wears off, they will definitely take them again and again. It is a cycle which never ends. I hope you got my point. And one important thing as well, that if the nurses noticed you right now checking them, this means that other patients could have noticed you as well. And this is very risky for your career if any patient complains about you. You have here many reasons to play on him. Number one, you are worried about his sake. Number two, this can affect his performance and his career. Number three, that this effect can wear off at any point and he will start having some depression or disappointment. Number four, the patients could have noticed him and they can inform the seniors or they can inform the hospital authorities. Okay?
Right.
This station, I think it's, this sounds very short station, but no, actually it is a great station. It's very long. Not very long, I mean, not lengthy, but it's like, it's boring. You still have to convince him too much. He's your colleague. It's not like a normal, simple patient. No, he's your colleague, which means that he needs more work from you.
Right.
Okay, next station is the alcohol and late colleague. This guy, mashallah, he is really innovative. He takes alcohol and he comes late, which means that he's not, he's doing everything wrong. So what are you going to do in this case? Actually, it is very similar to the past one. Number one, you will address one concern at one time. For example, or one matter at one time. You will tell him that I have noticed that you have been coming late, and then speak about coming late. And number two, you will speak about the alcohol. So you will cover coming late by asking some questions about coming late, and you will speak about alcohol and address it. Okay? This station is not long, don't worry about it. The only thing is that you will only tell him, you will accept not coming late, usually, but he will have a problem with alcohol. He may be reluctant at alcohol. So what are you going to do? You will address coming late, or you will address, for example, the alcohol first. Number two, you will address the coming late. Okay, this station is quite similar to the past ones. Please, it's very similar to the past ones. And two things to consider. If someone is taking alcohol, someone is taking recreational drugs, someone is taking anything which can cause any drowsiness, guys, please, please, please always check their safety. How to check their safety? By asking them if they drive back home and it's unsafe for them to drive back home. Okay. So this station, I told you, there's nothing new in it. They just bring them together, just because and mostly, by the way, it comes these days mostly the late colleague who comes. It came many times in the past month. Anyone has any question regarding the colleague station? Has anyone got any question regarding them? If anyone has any question, just feel free to ask right now. Again, has anyone got any question, guys?
Dr. Ahmed?
Yeah.
Okay, Dr. Zaid, you are asking or I should?
Yeah. Just, Dr. Ahmed, will we get a note about those scenarios or?
Actually, in the ethics, I will make notes. I told you about this. But just follow them now, and I will provide them to you in the end of the course, and it will take you. Yeah, they are not awkward, guys. Actually, you will read them only in 2 hours. You will read the whole things in 2 hours. But do not expect that I will write full answers. I will just give you quick hints about how to approach each station.
Right.
And I will give you some bullet points. That's all. In the ethics station, the problem is that you guys are always following scripts. But I do not want you to follow scripts. Why? Because actually what I'm telling you is so far away from the script sometimes. The concern is similar. The concern of the patient or the colleague is the same, but my answers are quite like different and a little bit renewed. How renewed? Because actually, if everyone say the same answer in the script, it will end like 20 people will fail, or 20. The examiner will be like annoying. Seriously, especially in the ethics. The ethics, you should be yourself.
Hello, Dr. Ahmad.
Yeah.
Is that a better option to give the guideline for taking break days or off days to come back from this situation? Do you think?
Yeah, sure. No, but actually, I told you in the alcohol, I told him that he should take few days or he should take a leave. But the problem in the cocaine, he doesn't have any problem. In the cocaine, he doesn't have any problem, seriously. He just, he just taking cocaine like for recreational use actually, and this started affecting his performance.
But last evening he was binge drinking, and along with that cocaine. So then how will you offer give the idea to take off or no? It's a bit. It's
Well,
just that evening he did actually. He agreed at the end that okay, this is first time I did.
Okay, this is good. Actually, if it is the first time, this doesn't mean that you should offer him any leave or anything. You can simply ask him, do you think you need any help with that? He will tell you, doctor, I'm not needing any help. I just did it once and it was for recreational use. You can offer it, but usually he doesn't need any help. He only needs help the one who's alcohol, who's having depression, because this guy really started having some alcohol abuse or alcohol dependency because of his low mood. This is the one who needs help. But the one with cocaine, this was a single episode, usually.
With the breakup case, you can just give that, okay, why don't you take rest?
Sure.
Rest some break, okay. Thank you, Aman.
Thank you. Dr. Masih, what is the meaning of your question? What is the core of what?
Core means I want to say that what exactly should we do in such situation? You are saying we do not follow the script. I also feel the same. But then how? How do we approach the
I have
patient?
a very good idea. Usually in the ethics station, the task contains everything. This is number one. Number two, in the ethics station, by the way, I have to tell you something and be honest with you. What I'm teaching you is the general, how can I say, the general map for the ethics or for each station. But if you pick up only 2 or 3 points from each station and form your own script, believe me, the examiner will be more happy with you. Why? Because they know very well right now that the 40 people are coming from 3 or 4 different and the 40 people, at least 10 of them will say same answers, the other 10 will say different answers, the other 10 will say different answers, and this way. So what happens is that I know some people who pass the ethics station without reading any script. Why? They got the twist of the script. For example, in the lead colleagues or in the colleagues station, you have to follow the SPICE protocol. What is the SPICE? Number 1, seek information. Number 2, initiative. Number 3, patient safety. How to assure or to address the patient safety? I told you how to assess the patient safety. Have you seen any patient today? This is a scheme which is very flexible to any ethical station, to any colleague station. Okay. After that, you will escalate to the senior. In case of substance abuse or in case of substance, you have to escalate to the senior. Why? You need to escalate to the senior because this is risky to him and to the patients as well. And in the end, you will offer support or you will offer solution. For other ethics station, you will, number 1, reason of visit. Number 3, some history or current history. Number 4, past medical history or some data gathering. Number 5, disclose. Number 6, address the concern. In case you do not know the matter or the issue, you should apologize. And in case you know very well, you should apologize first and then offer the excuse or offer the reason. Okay? Usually, always have this. I mean, many people do not, they focus on the station and they do not know the task. How come? How come you do this? I notice that many people do this. If you end up doing this, you will definitely not know about the station. You will definitely miss many knowledge. Because actually the task will contain everything. For example, in this task, it's written that not only you who notice that he's drinking, it's other people as well. So when you are convincing him, he would be reluctant to you. Now you can tell him, actually, it's not only me who follows this. Also, other people have followed it, or other people who have noticed it. Now he will be silent because it's not only you who did this. I hope my point was clear in this session. Okay, in the Alco, bullet points 1, 2, 3. 1, 2, 3. Number 1, reason of visit. Number 2, current condition. Number 3, if you ever can examine or not. Sorry, number 3 actually is medical history. Number 4, if you can examine or not. Number 5, disclose. After disclosure, usually comes the trouble. But what you can do, if you know the reason, you can apologize, and after apologizing 1 or 2 times, offer the reason. If you don't know the reason, you can only keep apologizing. This is what you can do. This is the angry patient. In the colleague, number 1, start building rapport. Rapport is the most important thing with a colleague. This is the rapport. Number 2, seek information, like telling him what happened exactly, when was that, would you like to share anything with me? This is a core which you have to seek information. After that, you will speak about the initiative. Which initiative? You will tell him that this can be dangerous to your career. Why, doctor? Because sometimes it can cause problems with the coordination and decision making, and this can affect or compromise our patient health and safety. So what can we do right now? Now ensure the patient safety. Check on any patients he has seen or prescribed anything. This is number 1. Number 2, the I, which is the E, which is escalating to the senior. You will escalate to the senior right now, but you will encourage him to involve the senior. It's not only you who is going to inform the senior. You will encourage him first to tell the senior, and you can even tell him that I can accompany you to the senior to talk to him with you. And in the end, you will support him. Like, for example, you're going to tell him that if you need any help with that, we can help you gladly. Okay? Give me 1 minute, guys. So, again, the alcohol and late colleague station, let's have a quick recap about it. You will speak about the alcohol drinking in the beginning. Usually this guy comes late and smells alcohol. You can think why he comes late and why he smells alcohol. Can you guess? Can anyone guess why he does both things? Just guess. Can anybody guess about that? Yeah?
Maybe he watched a bad movie, something like that, or something.
Oh, really?
What was the question?
Yeah, can anyone guess why he smells alcohol and why he comes late in the past few days?
Can't be depressed as well.
Can be what?
Depressed, or he's annoyed. He's trying
to. Can be
Least
depressed.
interested.
No.
Hello.
Yeah, hello.
Yeah, I think he drank in the morning time. That's why when he was coming that time he drank. That's why we are getting the smell.
So he drinks in the morning because he's hungover. To get over the hangover, he's drinking.
Actually, this could be very simple because of party. He's attending. He goes to a party in the night, and he drinks much alcohol in the night, and some of them are left over in the morning, and that's why he wakes up late because he goes back late from the party. That's why he comes late. So usually 1 point, the party. The party has led him to sleep late, and the party has led him to drink much alcohol. Okay, Dr. Islam, it's fine. Could be a relationship issue as well or depression, but most probably he is in the party. I mean, you need to explore the reasons on your own. But simply here, you have to address the alcohol, number one. Number two, the coming late. And usually, this sometimes he can give you that I have come late because I have been vomiting in the morning because of too much alcohol I drank. So at this point, you will tell him that even coming late can be due to your alcohol problem. So number one, address the alcohol like the same way in the past station. Number two, address the coming late thing in a separate way. And in the end, you will tell him about the patient safety, like any problem have happened due to your drinking problem. Okay. So in the end, actually, you will try some support to him. You will ask him to if he needs any support, and he will tell you, okay, doctor, I don't have any problem with that, but I don't need any help. He doesn't need any help, but sometimes he can be depressed, right? Dr. Samia, you say sometimes he can be depressed. That's right. Are you sure that it's only the alcohol colleague? Because it's coming like alcohol and the late colleague in the same time. The alcohol only is depressed because of a breakup, but the other one is the other one who's alcohol and late is because of party. Okay. So, I mean, if he's in the party, actually, this means that, by the way, still, he has been coming too much early, too much late, and too much alcohol in the past many times. So this means that he has long history of this, of alcohol and these things. And when you ask him history, he will tell you, doctor, I have been doing this in the past few months. This means that he needs support with this. Okay? So again, you will address the alcohol issue and you will address the coming late issue. And usually they are related together. He sleeps late because he spends the whole night drinking. He sleeps late and he wakes up late. That's why he comes late. So in the end, you will ask him, you can offer him some support actually because it is repeated, Dr. Yasmin. Here it is repeated. So you need to offer him some support if he needs any support with that. So next station, disclosing HIV. Dr. Zaid.
يا حبيبي.
Disclosing HIV. Imagine if you are going to disclose someone you are having HIV. God forbid to any of us. So, what will be his reaction? For example, if you're going to tell them you're having HIV, would they accept it normally? So please write it is breaking bad news, because in some notes it is not or it is not included as breaking bad news, but it is breaking bad news. Okay? So in this case, actually, it has been written that you are Fy2 in GP surgery, and the patient has been like he has visited the GP clinic 2 weeks ago or like 20 days ago because he was having lumps in his body, lumps, for which some tests have been done. All the tests came back negative, including the STI screening. But the P40, which is the antigen of the AIDS or HIV, has come positive twice. once in the first time and it was repeated again. So the test has been done twice and in both times it has become or it has come positive. Okay, so now you will enter to him, ask him some history. Again, number one, the reason of the visit. Number two, how is he feel? Elaborate the lumps that he was having. Which lumps he was having, by the way. How do we ask about the lumps, Dr. Elvira? Dr. Elvira, how do we ask about the lumps? Quickly.
Well, we ask about the lumps. Where are they? Are they painful? Where? So since when? Are they painful?
Okay.
And are they, how to say,
shape?
More a lump as well.
Yeah,
okay.
yeah, shape.
Would you please,
describe?
Tell me shape and
Describe
size
it.
of
Size, yes, exactly.
Would you say that it is attached to underlying skin?
He doesn't know about this. He doesn't know about this. Just ask him.
Okay.
You just ask him about shape, size and shape,
Size
and
and
you
shape,
can ask about the color as well, if possible. You will ask him if it's painful or not. Very enough here.
Painful.
Very enough.
And where around the body? Yeah.
Yeah, exactly. So number one, I will ask where are they. Number two, when did they start? Okay. Number three, you will ask him about the size of them, then the shape of them, any change in size or shape, and then you can ask about the color as well. Usually there are lumps in the groin, sometimes in the armpits. Okay. Yeah, if it is in other parts of the body as well. So usually this guy is having some lumps in neck and armpits, and that's why he got concerned and he went to the GP surgery to check on himself. Now I asked about the presenting complaint. What is the next step, Dr. Masih? After presenting complaint, what's next?
We can ask about the associated symptoms.
Exactly. And what you say before going to the associated symptoms?
Okay. I'm gonna ask you about. I'm gonna ask you some questions which might be related with.
Yeah, exactly. Perfect. Always keep this in your mind. I'm going to ask because this guy's already bored. He needs to know about the test result. So anyway, they're going to ask him this question like, do you have any weight loss? Do you have any diarrhea? Have you noticed any tiredness? Like other 2 or 3 symptoms of HIV. Then move to the past medical history. Here comes the important things. Here you will pick up your diagnosis from this point. Do you have any medical condition? Any high blood sugar? Do you take any medications? Now ask him, have you ever been hospitalized? What about any recent blood transfusion? Any needle stick recently? So ask these questions, you have to point out these 2 points, recent blood transfusion and any needle stick recently. Okay? And if possible, ask him about tattooing or piercing recently.
Sorry, but could you please repeat? What were the questions?
Again, blood transfusion, needle stick, and tattooing or piercing. Okay? Those 3 questions are the most important things in the past medical history. Why? Because they are reasons of HIV transmission. Then move to the lifestyle. In the lifestyle, you can only ask about his physical. You can ask about the lifestyle, but just try to be concise. Ask him about smoking and recreational drugs. By any chance, any recreational drugs? Okay. Why? Because this is one of the reasons of HIV transmission in UK as well. Now move to the core of this station. Sexual history. I'm going to ask you a few personal questions. Are you sexually active? Yes, doctor, I'm happily married since 5 years. And do you practice safe sex? Yes, doctor. By any chance, have you ever practiced unsafe sex? Yes, doctor. This was like maybe 1 week ago. Okay, I'm sorry to ask you, but by any chance, any other partner? No? Why are you saying this? Please don't feel embarrassed. As medical professionals, we always ask these questions to all our patients. Please, now you sign post before moving to the other partners. Always mention this. Okay? Again, guys, always signpost before moving to the other partner thing. By any chance, I'm sorry to ask you, but by any chance, any other partners? This way, he will respond to you, and he will be a little bit more understanding because this guy is very stubborn, right, Dr. Zaid? He's very stubborn.
Yeah, he's very in hurry and he wants the blood result immediately.
Yeah.
Yeah.
So now, in case he rushed you to the result, you will ask him first, okay, I just need to ask you a few questions and I will definitely discuss the result with you. You can ask him some questions, but if he pushes you again, now you need to disclose the result. How you will disclose the result? You will disclose the result actually as a breaking bad news. You will tell him, you came here a few weeks ago and we did this test results for you. And they showed that everything is normal. Even the sexual transmitted infection has become normal or has come normal. Oh, that's great, doctor. However, I have something else to share with you. Actually, something which is not encouraging. Oh, what is wrong, doctor? Um, I don't have good news. Would you like me to proceed? Yes, doctor, tell me. Would you like anyone to be by your side? Mm, doctor, I came here alone. Tell me, please. Actually, your test result shows that you're having HIV. Doctor, what is this? Is it serious? May I know why you think so? Doctor, I've heard very bad things about it. May I know what you heard? I've heard that it kills people, doctor. Well, actually, it is a viral infection which can attack our special type of immunity cells. And that's why the people who got infected with it, they are having more weak immunity, which puts them under the risk of infections. Oh, doctor, so I'm going to die? Well, reason why we are all here to help and support you. We can definitely help you out of this. For that, we are having a variety of options actually, and variety of treatments. Would you like me to tell you? Oh, yes, tell me please. I will tell you right now what to do to Samia about his wife. So tell me please, doctor, what are the treatments? Now you speak about the antiretroviral therapy, which is called HART, highly active antiretroviral therapy. Again, I will write it, HAART, highly active antiretroviral therapy. And they are a combination of drugs which can work or can prevent the viral doubling in the blood or in the cells. Oh, doctor, but doctor, why did I get it? Now you will tell him that it has got many reasons. Some of them are blood transfusion, actually, which you do not have from your history. So, but the thing is that actually it can be related to sexual intercourse, or it can be like transmitted through unprotected sex. So, do you have any idea what could be the reason here? Um, Doctor, I don't know. You will tell him, please feel free to share anything with me. We are all here to help you and support you. No one is going to judge you. Yes, doctor, I had unprotected sex maybe 1 month ago when I was in Germany. Mm. Thank you for sharing this with me. And by any chance, any other time? No, doctor. Doctor, but what about my wife? I had unprotected sex with her as well recently. This is a very valid question. Actually, I encourage you to inform her, to ask her to come for a sexual checkup. Or we are going to ask her to come for a sexual checkup. At first, you will encourage him to ask his wife to come for checkup. Usual checkup. Doctor, I don't want her to know. Now you can offer the anonymous notification. How? We are going to notify her anonymously, without mentioning your name and without mentioning anything. We are just going to send her an email or a telephone call to ask her to come for routine health checkup. So if he is reluctant to the wife, now you will say that we can notify her anonymously, without knowing your name and without knowing the reason. Doctor, but she is smart. She will get to know that I'm cheating to her. I don't want to tell her. Actually, I'm afraid that we are obliged to inform her to come for sexual health checkup because this can be risky if she doesn't come. She may need to receive the treatment as early as possible. So, if he even refuses the anonymous notification, this means that you as a doctor or as healthcare professional, you are forced or obliged to tell the wife because this is risky condition. This can cause serious implications to her health. So you can breach the confidentiality here by telling her come to the sexual checkup. Or you are going to tell him that okay, at this point actually we may need to inform her on your behalf without mentioning your name, without saying everything. But I'm afraid that if you do not accept, we are obliged to do this. And we can do it as well without mentioning your name. So number one, you encourage him. Number two, anonymous notification. Number two, but if he does not accept the anonymous notification, you still will tell him that we are obliged or we are forced to do this by law. And we are going to inform you beforehand about what we are going to say, and we are going to do it anonymously, which means that we will not mention your name. So anonymous notification, you offer it. Even if he does not accept anonymous notification, you are going to do it. Anonymous notification, or anonymously as well. Okay? I hope this was clear. You will do anonymous, you will offer anonymous notification. If he does not accept it, you will still do it. Okay, doctor. So now you see if he does not enclose or if he does not disclose about the reason, you will play it on your way. You will tell him that there are many reasons, but from your history, no reason was found. So do you have any idea what could be the reason? Yes, you know, doctor. Actually, it can be transmitted through sexual intercourse as well, unprotected sex. So feel free, please, to share with me everything in your mind or anything in your mind. I'll tell you what you want to know, doctor. By any chance, any other partner apart from your wife? You will tell you, yes, doctor. I went to Germany and had unprotected sex. Thank you for sharing this with me. So now, if anyone is reluctant to reassure, if he does not open up after reassurance, you can disclose the test results, and after disclosure, you can tell him, I found no reason. Now tell me what could be the reason. Okay? Okay. Next station is changing the stick note. I had this station in my exam. It's one of the challenging stations for one reason only, because no one knows what could be done to pass it. By the way, I passed it, but I passed it with 6. And the pass score was 4.9 or something. It was my first station, by the way. And simulator was very worried. Simulator was almost crying. So here she had an accident 2 weeks ago. Why she had this accident? You are FY2 in GP. You are FY2 in GP, yeah? And the girl or the patient actually, she is 25 years old girl. She had an accident 2 weeks ago, car accident. The car flipped over. She was heavy drinking. She went to the A&E. They examined her and did many examinations and investigations to her, and everything came back normal. So the A&E discharged her with a medical report to show that she's absolutely fine. However, the police has seized her car, and the police has seized her license because she was driving, she was drunk, and also the employer, she is working, she is a sales manager. The employer has seized her car after this accident. So the police seized the license and the employer seized the car. And the A&E discharged her, she was absolutely fine. Now she has got some concerns. She wants you to provide her with a sick note. Talk to the patient and address her concern, and special note, do not examine the patient. Sometimes it can be written, some other times it's not written. In my day, it was not written. So, you will enter this station. Doctor, please provide me the sick note, please, doctor. I need to how can I help you? She will tell you, doctor, I'm just here because I need a sick note. Well, okay, I'm definitely help you with that. Just let me ask you a few questions see if you are entitled to receive a sick note or not. Now start asking her. What you are going to ask her? May I know? I could see from my notes or from your notes that you had an accent. Could you tell me what happened exactly? She will tell you a very long story. And what happened next? I came to the A&E doctor, and what did they do to you? They examined me and they told me that I'm fine. They sent me home. Okay. And how are you feeling right now? See the previous thing and right now the current status. How are you feeling right now? Do you have any pain in any part of your body? Any problem in the movement? Any problem in sensation? No, I'm absolutely fine. Then start taking some medical history, past medical history from her, and taking some lifestyle, including the job. Does your job involve driving? Yes, doctor. Okay. Thank you for that. I'm going to examine you. In the examinations, please do not forget to do the exactly like the whiplash injury. You are going to examine the brachial plexus. So I'm going to examine the nerves in your neck and shoulder region. So please bear with me. The examiner either will tell you all examinations are normal, or the examiner will tell you, doctor, no need to examine the patient, which means that the patient is quite normal. Now move to the management. Tell her, thank you for bearing with me. So thank you, doctor. So now please I need a sick note. You will tell her, actually, from my assessment, it seems that you are quite fine. And also the A&E, they have examined you 2 weeks back and they have seen that you are quite fine. So actually, in this case, I'm not in a position to provide you with a sick note. Doctor, please, I need a sick note. May I know why you need a sick note? She needs a sick note. Okay, there was a special note saying that do not touch this lady. If the special note is present, this means that you do not examine her. But if it is not present, this means that you can at least verbalize. Verbalize. I do not say that you're going to do. You just verbalize. So, doctor, but please, I need a sick note. May I know why you need it? Doctor, actually, doctor, the police has seized my car, but they have seized my license. May I know why? Doctor, because I was drunk, actually. Now you can ask her some few questions about that. For example, how much do you drink? Have you ever thought of cutting? Doctor, this was just this night, doctor, and I never drink like this usually. So ask her some few questions, like for example, and what and now the police has seized her car. You will tell her that actually I'm not in a position to provide you with this sick note. You know why? Because actually to provide a sick note, we need someone who's having like serious problem, some physical problem to provide them. And from my assessment, it seems that you are quite right or quite fine. Doctor, but you can write anything. You can write that it could be whiplash injury. Well, may I know why you think so? Doctor, just doctor, because I know that whiplashes are common with such injury or such accident. Well, I'm glad that you know about that, but actually, in your case, the A&E have examined you, and also I re-examined you today, and everything came back normal. And in whiplash, usually there is pain in the back, which is not the case in you. Doctor, but please do anything, doctor. Please do anything. Write anything in a sick note. Now you can tell her that actually I'm afraid I can't do this because this is illegal. We are bound to some ethical rules and we cannot report anything which is not found. Doctor, but I need to be paid. I need to be paid at least for the few weeks which I was absent from the work. So she needs to receive a refund for the past few weeks because she was not paid anything by the employer. So now she needs to receive a refund from the NHS. She will tell you, doctor, but at least I deserve to receive a refund to my taxes in the past few weeks. The NHS have to pay for this. You will tell her that I'm afraid actually in your case we cannot do this because usually we pay or we usually do this for the people who are having a physical reason, like maybe any disability or any problem with the accident. Doctor, please help me. Doctor, please help me. Now you will offer her some benefits, like we can help you by like for example, sending to the local council. You can be entitled to receive benefits. So you will offer benefits. Doctor, but I need a sick note. I'm afraid I can't do this. Okay, okay, doctor. So here she has been off work in the past few weeks because actually the police has seized her license and the employer has seized her car, so she did not have any income. So she is here because she needs you to provide a sick note to be paid or to provide it to be paid for the past few weeks, which you can't do. So you can ask her that we can offer you benefits because she is a single mother. We can offer you benefits. I can imagine how it can be frustrating or hard to you, but we can offer you benefits if you wish. Doctor, but can't you provide me the sick note as well? I'm sorry, I can't do this. This is a station. Number one, you cannot change the sick note. You have to ask why. You have to change sick note. You cannot change sick note because she was absolutely fine. She doesn't have any physical problem. And number three as well, she can be entitled to receive benefits because she's a single mother and she doesn't have any income. And the local council as well can help her with finding a new job. Okay, this is a station. You are not able to provide sick note and you can offer her some benefits. This is the station, the old station. And keep asking why, why. Okay? Okay. Let's discuss one more station, which is the care received in hospital. What is the station of the care received in hospital? It is simply the station which the mother have entered the ward and she found that her child is drowned in a pool. So when she came, she was shocked. She was shocked because of the scene of the pool in which her baby was drowned. So now she's an angry patient. How to deal with her. Number one, assess the reason of visit. Why he was admitted to the hospital. Number two, his current condition. Number three, past medical history. So in the past medical history, you'll find that this boy have been diagnosed with enterocolitis and many other things because he was born premature. So you will sympathize with her. I am sure that it's quite challenging for you and it's tough time for you, but we definitely our duty to help and support you. Now take some birdie questions from her about the baby and move to the concern. What is the concern? She needs to know why he is drawn in the pool. You know why he was drawn in the pool, Dr. Zaid? Dr. Zaid, do you know why he was drawn in the pool? Yeah, do you know why he was drawn in the pool? It's not mentioned in the task, by the way.
No, it's not mentioned. Yeah.
Okay,
I don't know.
Yes, exactly. So we are going to talk to the nurse to find out what has happened, and we will definitely go back to you, and we'll ask them to go back and explain themselves to you. Okay. After that, she will tell you, but I need to know why this happened. I need to know. She insists, and you will insist on apologizing as well. But if she asks you one question, she will tell you, Doctor, I noticed that the nurse, oh my God, the doctor, they keep changing all the time on him. I need one fixed nurse to supervise him. You will tell her, definitely, I can arrange, I can help you with that. We can ask a senior nurse to supervise his care. But I'm afraid this is not applicable to happen 24/7. Because she needs one skilled nurse to supervise his care like all the time. This is not applicable. Why? Because the nurses work in shifts. This means that you can arrange a senior nurse to supervise his care, but not to be with him all the time. Okay? Now you can ask her, or she can ask the doctor, but the nurses, they are, oh my God, I need a senior nurse recently, really. May I know why? Because doctor, your nurse colleagues are not competent enough. They do not take care of him. They overlook him. Keep apologizing and tell her that actually this shouldn't have happened. However, our nurse colleagues, they are all qualified and competent to work with this. Having said that, I definitely will have a talk to them to find out what happened. Doctor, I think I should take him to a private care. Why? You know why? Doctor, I'm not happy with the treatment. You can simply tell her that actually it's your choice definitely to take him to a private care or not. However, we will do our best to make sure that this doesn't happen again. And again, accept my apologies. Actually, your feedback will help us to improve the services provided to him and to all our patients. So it's her right to take him to the private care, but what you can do, you can keep apologizing. You usually will keep apologizing and tell her that we definitely will consider this to improve our services provided. Very good. Now move to the last thing. Actually, she will tell you, okay, doctor, thank you for today. This is the whole station. She's angry because her little one was drawn in pool. So you will definitely talk to the nurse colleague to find out what happened, and you'll definitely arrange the best thing for him to make sure that it doesn't happen again. And she will ask senior nurse to supervise him, which you can't do all the time because the nurse. Yes, definitely. Yes, that's right. That's a good thing. I'm going to come to this. Nurse colleagues actually are not able to supervise his care 24/7 because they work in shifts. So it is not impossible for one person to supervise his care, and he needs 24/7 care. What we can do, arrange a senior nurse to supervise his care, but not be with him all the time. She will tell you that other nurses were more competent and qualified in the private care. I need to shift him to the private care. Definitely it's your choice. However, such feedback will improve us, and actually our nurses are qualified and competent enough to deal with that. However, I'm definitely going to have a call with them or have a talk with them. Okay. In the end, actually, you can fill an instant form. Why? Because there's something bad which happened in the hospital, something bad which could really affect the care and the health of someone. Something real bad happened. So you need to report that. And if she needs to make a complaint, you can offer pulse. In the end, if she needs to make a complaint, but you do not offer pulse from yourself, if she ever wants to make a complaint, you can offer pulse. Okay? Okay. This is quite short station as well, but she's very angry. She's the most angry, by the way. I mean, as a simulator, she's the most angry. Okay. So, has anyone got any question regarding this station? Has anyone got any question? Again, anyone has got any question, guys? Check back again, guys. Has anyone has got any question? Because I'm going to give you 5 minutes break right now. Anyone has got any question, guys? We are left with one station. No, 1, 2, 3. 4, 5 stations and 2 medicine, which we can finish maybe in less than an hour. And the next stations are easy as well. The social media station as well, I have made a recording to it. Have anyone here listened to the recording that I posted to the social media station? The colleague who posted on social media? Okay, I will post it to you right now in the break, in the 5 minutes break. I will send it to you on the group right now. And after the 5 minutes break, I will talk to you. I will come back, okay? Okay. So see you in 5 minutes. Hello everyone. I'm sorry for the delay. Okay. Um, are you here, guys? Everyone is following now? Everyone is following? Uh, okay. Dr. Ella, and by the way, guys, whenever you are having any question, you can. We are here in the course. Okay. So if anyone has any question, you can better ask me. So for example, I noticed that Dr. Wala has been posting questions in the group, on the big group. We can better share it actually here on our course group so that everyone benefits. Dr. Ella, actually the Simman Melina is not a new one. It is the upper GI bleed station. Okay? And you will be given Simman stations in one day. You will be given their recordings and you will be practicing them with me. And this is what we agreed on. I mean, you will listen to the Simman recordings and you will come one day to practice them with me in 1 hour or 1 hour and a half session. Okay, so let's move to the next station, which is the missed hairline fracture. What is the missed hairline fracture? Your FY2 working in surgery department. The patient is, for example, he is maybe he is maybe like 7 or 8 years old child, and he has been admitted here, or he has came here in the hospital a few days back. Okay, your colleague has examined him and he ordered X-ray for him. The X-ray shows missed hairline fracture. Sorry, the X-ray showed hairline fracture, but your colleague didn't spot it. I mean, your colleague was not able to notice it. So he gave the child painkillers and he discharged him home. Now, the radiology report has been sent to your department and it shows that the X-ray shows that there is hairline fracture. You called the father to come, okay, and you're going to talk to him right now. Or the father is here for the review. Talk to him and disclose the error to him and address his review, address his concern. What you are going to do right now, very simple. Number one, again, reason for the previous admission or reason for the previous visit. He will tell you that his son had a fall. Okay, what happened exactly, or what was his presentation? He was having pain and swelling, maybe. And check the number two, check the current condition. What is the current condition? How is he feeling right now? How is his pain? How is his swelling? Like this. Okay. Now, actually, still the condition is not improving probably because he is still having the fracture which was not treated. What are you going to do right now? Take some birdie questions as well. After that, you will say, I'm going to examine your little one. The examiner will give you that will tell you that there is swelling and bruise still present. Now disclose the error again, like we agreed before. Actually, I'm here to discuss something with you which happened. Actually, my colleague has examined him and he's charged him with some painkillers. However, after sending him home, we received the radiology report. Has anyone told you about the report? Actually, the report shows that he's having hairline fracture. His face will change. Hairline, what is this, doctor? Actually, it is a simple fracture, which means that the bones are still in the same place or are in place. It is very simple, it's very common, and it's not associated with any soft tissue or surrounding tissue injury. So my little one has broken bone? I'm afraid he had, yes. How could this happen? Now you'll keep apologizing and you will say that I'm going to talk to him to find out what happened. And actually, I'm going to ask him why he didn't wait for the radiology report. So you are going to talk to him to find what happened, and you're going to ask him why he didn't wait for the radiology report. Doctor, I can't imagine. Actually, I'm really sorry for what happened. He should have waited for the radiology report before sending him like this. Doctor, so what now? The plan now, it's written in the task, the plan says that the specialist or the plan now is that you will stabilize the fracture by a cast, and you will review him in 2 weeks. And the one who will stabilize the fracture is the orthopedic specialist, or just say the specialist. So the plan now is that you are going to show him, or you are going to arrange a meeting for him with the specialist to review him, and they will definitely apply a cast. When can they apply a cast? They can apply it right away after checking him. So what's next, doctor? We review him in 2 weeks after that. Doctor, will this affect the treatment? This doesn't affect the treatment actually, because this is a simple fracture. However, we need to stabilize it as well. What are the complications? The fracture has no complications because it's not associated with any soft tissue injury. Are there any complications to the cast? Usually cast has no complication, but there can be some tingling sensation which will go away on its own. So again, he will ask you about complication of the cast, he will ask you about complication of the fracture, he will ask you about the complication or about the fracture itself, how will it affect my little one? You will say that it is simple hairline, which means that the bones are in the same place still with simple displacement, or they are still in place without any soft tissue injury. Now you should apologize and ask the colleague to find out what happened and why he didn't wait for the radiology report. In the end, he will ask you, doctor, does it happen a lot in your hospital? You will now offer instant form, and if he insists on complaining, you will bring a pulse. This is the whole station, typically like any angry patient station. 4 important information to know from this station. Hairline fracture is a simple fracture, which means that the bone are still in the same place. No soft tissue injury associated, therefore no complications. The delay in the treatment will not cause anything because it's very simple fracture, okay, and very common one. And number 4 as well, you are going to apologize for the colleague, what happened from the colleague and why he didn't wait for the radiology report. Okay, this is the whole station. Okay, next station is a medical error as well, which is missed MI. The missed MI, the guy, he has come here in the hospital 2 days back. He was having heart attack. And the ECG has been done and the cardiac enzymes have been done. ECG was normal. The patient was sent after the ECG without waiting for the result of the blood test, which is the troponin. Now he came again 2 days ago or 1 day ago because of heart attack. He was admitted in the hospital. He has been given treatment and he has undergone the PCI. So this guy had 2 heart attacks. One of them was 5 days ago, which was missed. The other one came 2 days back, for which he was admitted in the hospital. So now disclose the error to him. He will address number 1, reason for previous visit. Here it's separate because there are 2 admissions or 2 visits. The first visit which happened 1 week ago or 5 days ago, and second visit which happened 2 days ago. He will address each visit. And how is he feeling right now? And after that, take some medical history from him and lifestyle as well. And after that, unfortunately, we will disclose the medical error to him. Doctor, now you will tell him, do you have any idea why I wanted to do, what I wanted to tell to you? No, doctor, actually, I'm afraid to tell you that when you came first time, you were having heart attack, which was not spotted. How, doctor? Actually, my colleague, he sent you home after the ECG. He should have waited for the result of the blood test. Oh my God, this means that, doctor, I wouldn't have this heart attack this time? I mean, if my previous heart attack was treated, I would not have this heart attack this time? Yes, I'm afraid that it is. Now you will keep apologizing and telling I will talk to him to find out what happened. I will talk to find what happened. Please accept my apology. Now he will tell you, doctor, he asks you, doctor, does it happen a lot in your hospital? Now you will offer the instant form. And in the end, if he insists on complaining, what you will do, you will offer pause. Meanwhile, you can give him some advices if you have time, some advices regarding the lifestyle and regarding the compliance with the hypertension medication which he is having. I mean, this is MI, so you can tell him in the end, if you ever have time, you can tell him that we advise you to follow with your medications or you comply with your medications and um, make some lifestyle changes as well. Okay, so this is a station. Usually the angry patient station, or sorry, the medical error stations are quite similar. No difference in them. No difference in them at all. There is no difference at all in them. The only difference is from one finding to another, which will be given to you in the history. Okay? So your approach, no problem, Dr. Rivera. Your approach, number one, reason of visit. Number two, current condition. Number three, medical history. Number four, examine if possible. Number five, disclose. And keep apologizing. When you keep apologizing, you will apologize once and twice, and after that, give the reason. And after giving a reason in the second thing or in the next thing, you can offer a solution. After offering a solution, you will have to address the patient's concern regarding this solution. For example, we need you to come back to the hospital to take a blood sample from you. No, doctor, I won't come. May I know why? Like this, you will address the concern regarding the solutions. In the end, you will offer instant form, and after that, you will, if he insists on complaining, you will bring it house. Has anyone got any questions regarding the medical errors so far?
Yes, I got one. Yes.
Yeah, sure.
Yeah. Just regarding, what's when you give the reasons and after give the solution, can we say this one and can we say the apologies and the reasons and the solution in one line or?
No. Don't do this. Don't do this. For example, you will say that, please accept my apologies. This shouldn't have happened. However, actually, yesterday I was a little bit busy. I was having many samples to label. That's why I forgot to label it. Having said that, this shouldn't be an excuse, and I'm really sorry. So this is ultimately what you can do, is to give an excuse after apologizing. But the solution is something else. Like, for example, now you apologize and gave him a solution. After that, he will tell you, so what's next? You will tell him, actually, we need you to come back to the hospital to take another sample from us, from you. Oh, no, I can't like this. Do not offer solution together. I mean, just make your sentence like apology and apology and excuse, or apology and reason. But do not say many things in one go, because you will be lost.
Okay.
Because the ethics sessions are really short. So if you give everything in one go, you will end up like finishing everything of the whole station in 4 or 5 minutes. So please break it in layers. Let him ask you what's next, or what can this happen, or how could this happen, like this, to justify yourself and to offer solutions later on this.
Yeah, I get a case of this is amoxicillin rash.
Oh, I got it.
It was near miss.
Yeah, near miss. Yes.
It was twisted.
Yeah, I got it by the way.
Yeah, I scored 3.
Yeah, she's very stubborn lady, by the way. She's very stubborn, and she's really bored. She's not interested, like what Dr. Masih just said. She's really not interested in anything.
Not interested, yes.
My mission here in this case was to bring her back on track. For example, I would tell her that I asked her some history. Like, actually, I took long history from her. And in the end, I would tell her that you can see, I told her like this, actually. I told her that you seem to be quite annoyed, or you're quite bothered by something. May I know what is this? She told me, doctor, I don't like what happened. Even after apologizing and after doing that, she told me, I don't like what happened. Does it happen a lot in your hospital? I told her, why? I'm glad that you share this with me. At least we can reach a solution with that. Let me tell you what we can do. Now she got interested. It's your mission to ask her, but I can tell you one thing. You know, this way you are like attracting someone, but I can't give you a solution, but I can offer you something. We are having, for example, these sentences can always interest anyone in your talk. But listen, we're having very good options in this. You know, like the media people or the propaganda when they are telling you, but listen, you're not alone from now. You're having this option. You know, like this. But listen, we can offer you a variety of options in this, or you can, no, in this case, we can offer you one thing. Listen, actually, let me tell you what we can do in these situations. But it's my pleasure actually that you share this with me because you know, this case is very helpful to us to improve our services. Do you know how? How, doctor? Now, in this case, we are going to fill something we call instant form. Would you like me to tell you about it? See, you're involving here all the time, and you know this station will barely take you 3 or 4 minutes to address your concern. So why don't you involve here all the time like you are talking to your little brother or your little daughter or whoever? If you keep involving anyone, especially the angry patient, you will end up scoring very high. And please, in the middle, like for example, we can do this and this and this and that. Are you following me? Yes, doctor. Do you have any concerns so far? See, when the moment or the more you involve, Dr. Zaid, maybe you have a little bit misunderstanding. In PLAB2, it's very good to know the answer to each question. But what's even better is to know the answer and you know it very well, but at the same time, you are keen on the patient understanding. If I am pausing every now and then to check on the patient understanding, definitely your score would be, I mean, you will be already scored and your score was put, okay? And now you are like just completing the station. The examiner observes how you are going to involve them. If you are going to involve them and include them in all your talks and all your conversations, like this way, definitely your score is already done. They don't care about your answers. Your answer are already known. Just in very few cases, they care about your answer. But if you keep involving the patient and trying to trying to please the patient and try to support the patient all the time, tell me, if this happens before your eyes and you are having some doctor who is really keen on the patient understanding and involving and observing them all the time, and some other doctor who just keeps like narrating the whole story or like monotony. Like for example, we need you to come back to take a sample from you, and by the way, the sample will be very quick. We won't give you, we will not make you wait for a long waiting list, and this will be a sharp scratch. Who would attract you more? Whom you would work with you? He is the one actually who cares more about this patient. I don't care about what happens in the clinical practice. I mean this is still this is an exam. So anyone has any questions so far? Dr. Zaid, was it clear?
Yeah, clear. Thank you.
My pleasure, Dr. Zaid. My pleasure. Okay, we are having 2 more stations from the ethics before moving to the medicine stations. Medicine stations will barely take us 10 minutes today because they are short stations. The polymyalgia rheumatica and one thing actually, which is the sciatica. Okay. Now, we are left with 2 ethics stations, which are the dementia mother and the angry son who wants the mother to be admitted. Okay, well, guys, I just need to postpone this station of the angry son who wants the mother to be admitted. I will let it be tomorrow, but I will bring one station instead of it today, which is the elder abuse, because the elder abuse is actually is the elder abuse. Okay, Dr. Safa, no problem, no problem. The elder abuse is because of dementia. I mean, she's abusing her mother because she's having dementia. The mother is having dementia. So it's more or less having some similar content. Okay, so in the dementia case, simply, um, In the dementia case, the mother the lady or the mother was admitted here because of weight loss. Weight loss, and the task tells you that many examinations and investigations have been done and they all came back normal. Talk to the daughter, and so the weight loss was found to be because of dementia. Talk to the daughter and disclose what have you done to the mother and address her concern. So investigations have been done. All of them came back normal. The reason for the weight loss was found to be dementia. What you have done, you have given her some fluids and she was able to tolerate fluids and she is taking semi-solid food. And she started eating back again. Talk to the daughter and address her concern and disclose the mother condition to her. Special note, none. Now you will talk to the girl.
Dr. Ahmed, how come it is ethics case? Sounds like counseling, isn't it?
No, you will know right now. Actually, it is not counseling. You know why? Listen, in the counseling, usually you are having the one to counsel. But here you are talking to the daughter, not to the mother. Did you get it? Why? Because this mother needs support. You will know right now how the scenario will work.
Okay, thank you.
Okay, when you enter, she will tell you, doctor, tell me, please, doctor, my mother has been losing weight and I have been so worried about her. That's why I brought you here to the hospital. Please tell me, doctor, what's wrong with her? Reassure her and tell her that we have done many investigations to her. Everything came back normal. And the reason for weight loss has been found to be because of her dementia. Oh, doctor, what have you done to her? You will speak about the investigations which are mentioned in the task. What investigations have been done here? All the blood tests, all the urine tests, all the scans have been done. ECG has been done. Everything has been done. Everything came back normal. So you will tell her about everything which was done, okay? And she will tell you, doctor, so what is the relation between the dementia and her weight loss? Or you can simply bring this matter up. You can simply tell her that all the investigations came back normal, we did this and this and that, and everything came back normal. So do you have any idea what could be the reason of her weight loss? Why, doctor? You will tell her because of dementia. Oh, doctor, what do you mean? Now, this means that, okay, this is a very good idea. Now you have to, first of all, elaborate or to explain the dementia to her. First of all, ask her, do you know what dementia is? She will tell you, yes, doctor, it's maybe some memory problem and behavior problem. Yes, that's right. And actually, sometimes it can cause some troubles with the weight or with the feeding. For example, our patients can forget to take their meals. They can forget about their previous food habits. They may lose interest in food because due to difficulty in swallowing, and that's why they may have this problem, weight loss. Oh, doctor, that's why she was losing weight. So now you reassured her and told her what you have done. Number two, explain the dementia and its relation with the food. Number three, take some history from her. Which history? You would tell her some social history. For example, number one, does your mother is having any other medical condition apart from dementia? No, no, doctor. Tell me, how has this dementia affected her life? She will tell you that she has been like not eating well. She will tell you everything. Now ask her about who takes care of the mother. She will tell you, I'm only her only carer, doctor. I only take care of her. You know what do you do for a living? Doctor, I used to work as a part-time, but I took leave from my work to take care of my mother. So this daughter life has been affected by her care to the mother. So you need to offer support. Again, you will number two, after explaining the dementia, you will take some medical history about the mother. Number three, you will take social history from the daughter. And in the end, you will start your management. Thank you for bearing with me. Now you know why she has lost weight, right? She will tell you, yes, doctor, but what have you done for her? You will tell her that we have given her. By the way, she can ask you this question: what have you done for her? You can say the examinations and the investigations, and after that you can say that we have given her some steps of flower. This in the beginning, but you can also say it in the end. I mean, no specific pattern here. The most important thing is to reassure, number one, and tell her what you have done to the mother in terms of investigation and examinations. And number three, you will explain the dementia to her and assess her idea about the dementia. Okay? Okay. Now take some medical and social history, and after that, we'll explain to her what we have done. We have given her some sips of fluid, and she has been tolerating some semi-solid food, which means that hopefully, after some time, she will be able to tolerate usual food. Doctor, but why did she have this problem? You told her that the relation between the dementia and feeding. Doctor, can't you simply keep her in the hospital? May I know why? Doctor, because she needs proper feeding. Actually, we cannot keep her in the hospital. Why? By the way, the task will tell you that keeping or admission in the hospital has been decided to be inappropriate by the multidisciplinary team, the MDT. Why we can't keep her in the hospital? Because, number one, staying in the hospital is frustrating or disappointing for the people in old age and can have some complications. Number two, her condition doesn't need hospital admission. Actually, it needs patience and proper feeding or accommodating her feeding habits. Okay, she will ask you, Doctor, can't you give her or pass this tube to her? She means the nasogastric tube. You will, by the way, the task as well tells you that the nasogastric tube has been determined to be inappropriate. You will tell her that the NGT or the tube has been decided by the MDT to not to be appropriate. Why? Number one, her condition, again, her condition needs patience, but NGT is a fast method. Number two, the NGT can be as well disappointing or irritating to the old age people. Okay, that's it. Okay, so now she will ask you, but what can I do for her, doctor? You will ask her, what have you done? She will tell you, doctor, actually, I have tried to feed her by myself, but I didn't manage. You can give her some few advices, like for example, try to accommodate her food habits, try to not make her stressed while taking the meal, leave long gaps or long time for, or long period for the meal time or for the lunch time. Try to cook for her her usual or her favorite food. Maybe she will remember it. If possible, you can try to feed her by yourself. Don't show her that you are anxious, because she will likely feel that and she will feel more anxious and leave the food. Doctor, but you told me that you are going to support me. I feel this is too much, doctor. So now you will offer her some dementia support. The things that I'm going to say are the things. Okay, yesterday I told you that I'm going to post you some approach for insomnia and domestic violence and colleagues. And as well, I will tell you right now about the dementia case, and I will write it and I post it. So now I have to post four things. Okay, let's start with the dementia. You will tell her that there are some, we can provide you some options actually. Two of them will include your mother moving to someplace else, and one or two other are including that your mother can stay with you. What would you like me to tell you? She will tell you, doctor, tell me, doctor, about, tell me what if I want my mother to stay with me? Two options here. Number one, admiral nurses. Admiral nurses are special nurses for the dementia cases. They can come and take care of her, and they can be provided by the GP. The second option is daycare. Daycare in which she can visit like a special unit by the daytime, in which she can meet another, or where she can meet actually other dementia patients and other dementia staff like doctors and nurses, and she will receive the support and she will go back home by the end of the day. These are the two options in which she will stay at home with her, but only with some disturbance. Like one of them she will go in the daytime, and the other one there will be admiral nurse with her. Doctor, what if I want her to move to somewhere else? Two options. Number one, hospice care. It's called hospice care. Let me write it. Hospice. For those who do not know about it, hospice care. Number one. Wait, I sent it in private. Hospice care. This is number one. Number two, which is the usual option, care home. What is hospice care? It is like the care home, but it's special for the dementia. So she will be resident in a special. She will be resident in a special dementia residential unit. What about the care home? Like you all know, care home. Most of the old people end up at care home, which is like suitable and peaceful environment for them. What would you like us to arrange for you? Doctor, let me think about it. Okay, thank you. Those are the dementia, and it's a very easy selection, by the way. But she is worried in the beginning, so you will have to reassure her that your mother is well. We have provided her some food, and she's able to tolerate it. And we have done some other investigations. Would you like me to tell you? After disclosing, she will tell you why this happened. You will say because of dementia, and you will explain why the dementia has caused this. Now take some history from here. Number one, medical history. Number two, social history. And after that, discuss the management or address her concern with her. The hospital admission, the NG tube, what can be done later, and this. Okay. So this is a station of the dementia. Other station as well is a elder abuse. Usually in the elder abuse case, it is actually because of dementia as well. Here in this task, actually, the mother has been admitted because of having a fall. Your colleague has examined her, or your nurse colleague has examined her, and she found many bruises on her chest. Many investigations have been done, the initials, and the X-ray result has been waiting. The chest X-ray result has been awaiting. And she will be reviewed by specialists in a while. Okay? Okay. So now when you enter, you will find that the daughter is worried. She's going to tell you, doctor, what's wrong with my mother? Please tell me. Tell her that your mother was having some bruise on her chest. We took care of her and we have given her some painkillers. And we have also done some chest x-rays, which we are waiting the results and the review by specialist. Doctor, how is she? Now you reassure her that everything is fine, we are taking care of her. Now you can ask some questions, or you will tell her. But one thing we found also is that she was having multiple bruises on her chest. Do you have any idea what happened to her? She will deny. She told no. Would you like to share anything with us? No. Okay. Now you can start asking her some history. Which history here? Number one, ask her about who takes care of your mother. She will say, me, doctor. And may I know what you do for a living? She will tell you, I'm full-time job. And anyone else takes care of your mother? She will say, no. So how are you coping with that? She will tell you, doctor, it's so hard to me. I don't know, doctor, what to do really. We can definitely help you with that. Anyone else helps you with that? She can say yes or no. She can say that my kids also take care of her. How is their relationship with her? She will tell you, doctor, not so fine. May I know why? Actually, because she's having dementia, doctor. So now she's having dementia and she is sitting with the mother and with the girl and the kids. Okay, and the other thing as well is that she has been having many bruises in the chest. So you took some history, social history from the daughter about who takes care, and you took some history, you will take some history, some medical history about the mother, like how has the dementia affected her life, and does she have any other medical condition? By any chance, did you notice that she bumps into objects recently, or are you aware of any instance which happened to her? Okay, no. Okay, so also ask some lifestyle questions. Ask about the environment, because you know that she had a fall. When someone is having a fall, we need to ask about the environment, like how is the house condition, wet floor, light, does she have any problem with the ear or the vision? So again, to sum it up, you will take some social history, you will elaborate the dementia, medical history, elaborate the dementia, and you will ask about if she bumps into other objects or not, or if she have any other medical condition like eye problem or ear problem or infection. Now ask about the lifestyle, and in the end you will take the environment, like for example the home condition. Okay, now you will tell her that thank you for bearing with me, I need to examine your mother again. The examiner will tell you the examinations are similar to your task, only the chest bruises. So you will tell her that actually we need to keep your mother with us in the management. Why, doctor? Because actually of these chest bruises, we're waiting for the X-ray results, and we also need to do further investigations to confirm that there is no other physical injury. Which injury, doctor? You will tell her that this injury or having multiple falls or these bruises can be associated with other injuries, like for example in the tummy or in the head, for which we need to do some CT scans and ultrasound scan. Okay, doctor. Thank you, doctor. For how long should it stay? We don't know yet. We are waiting for a specialist review, and we will decide on the best possible treatment for her chest bruise. You told me also that you cannot cope with your mother care. Would you like us to give you some options? And you will say similar options like the bus station as well. Similar options, like 2 options in which she can stay and 2 other options in which she can go. In the end, she will tell you, doctor. And by the way, after offering these options, you will involve social services. Why involve social services? Because you are suspecting non-accidental injury here. So you will tell her actually, and as well we can inform social services to look after her care as well. So you will offer these options, the dementia options, and you will involve social services as well after involving senior. Doctor, when she hears the social services, she will tell you, doctor, actually I lied to you. I pushed her in the morning because I was so stressed. She was asking me and I was rushing to my work. You will tell her I can imagine how it can be frustrating and tough time to you. Please don't feel discouraged. We are going to support you and we are going to ask social services to take care of this matter. Have anyone or has anyone got any question? I know that it sounds to you that ethics can be boring, like or overwhelming, but the thing is that what I say that or what I feel that I'm repeating the same things again. Like they are almost very similar in all the approaches and everything. The only problem is that you have to pick up 2 or 3 important points in each station. Dr. Zaid, by the way, when is your exam? Dr. Zaid.
Hello. Yes. Well, my exam is gonna be in July, not now.
Okay, so that's good. And who here is having their exams in May? Who here are having their exams in May? Dr. Mahdi, Dr. Elvira, Dr. Muniba, and Dr. Masih, and who else? Dr. Manisha. Dr. Manisha, when is your exam? Okay, still so far. Your exam is, when is your exam, Dr. Islam? It's far, right? So if, yeah, 23rd of March, 23rd of May, sorry. Okay, so I hope by the beginning of the month I can provide you with the ethics notes, like sum up of all the ethics stations, like 2 or 3 lines to remember from each station. and even shorter than the notes we used to provide in the beginning, just to pick up the more important points in each station, so that you can read all the ethics station in 1 or 2 hours. Give them a quick look only. That's what I need from you. Would that be good? I mean, I do not need you to study too much. For everyone, I think, not only for you, Dr. May. I do not need you to study too much for the ethics script, because me, myself, I did not follow the script. I just followed what the patient would ask. Okay. Now we are done with the ethics station for today. Let's move to two medicine stations very quickly. The medicine stations are the polymyalgia rheumatica. I used to hate this station at the beginning, actually, because it's quite nonsense. I don't know how. Anyway, it's like from the GP. But anyway, after that, it turned out to be one of the easiest stations. The only problem is that you can take a little bit time in elaborating it and trying to treat him or treat her, sorry. So here in this station, the patient is presented with generalized muscle pain. Generalized pain. This is the only presentation here. Again, the only presentation is generalized pain. Usually this is muscular pain. And you are FY2 working in GP. By the way, polymyalgia rheumatica can be treated normally in GP and totally in GP. Just for your information, and actually no need to involve the specialist here. You can treat the patient fully from A to Z. Okay, this is for the people who can be confused about it. Okay, now talk to the patient and address her concern. Okay, no problem, Dr. Maria, you can leave right now. Just we discussed polymyalgia rheumatica, and I think the Sierra will be tomorrow. So we will be left with one medicine station tomorrow as well. So it will take us only 5 minutes to finish today. For the polymyalgia rheumatica, the patient complaint is generalized pain all over the body. You will elaborate the pain by Socrates, but any long-standing pain, what would you ask Dr. Yasmin?
How you are coping with this?
Yeah, exactly. Or how has this affected your life?
First of all, Dr. Ahmad, it is not presented with generalized pain. Yeah, I got this station and I got 11 score in that.
Good.
It was presented with the pain in shoulder and thigh, hip, not the generalized pain. Okay, presenting complaint was this in my case at least.
But didn't she point you around all over his body?
No.
Okay.
Only 2 areas. Then I elaborated about 2 areas.
The shoulder and the thigh, right?
Shoulder girdle and pelvic girdle is the main affected area. But other than that, you will ask, definitely, you will ask, is any other place, any other joint? You will ask, definitely. But she presented with 2, pen, X.
Your voice is interrupting.
Oh, it's not from my side.
Is it from my side, guys? Okay.
Yeah, it's from your side.
Okay.
Okay, so patient presented with pain and X in pelvic girdle and shoulder girdle. Then I asked her, could you please elaborate it? Then she told me that, okay, when I'm trying to getting up from the sitting position, it's giving me pain.
Proximal myopathy.
When I'm trying to do something uplifting activities, like trying to get something on the chest, so that was the main presentation. Then I asked too, is there any other joints are involved? Are you feeling it is stiff? More in the morning, just like that.
Okay. So she is presented with pain. You will ask her, are you comfortable to talk this at the beginning? She will tell you, yes, doctor, I can manage. Now elaborate the Socrates. Where is the pain? She will point toward his shoulder and thigh. Okay, on both sides. You will elaborate the Socrates. You will find that it started a few weeks ago, and painkillers are not helping here. But sometimes, when you just ask her to describe the pain, she will tell you, doctor, it looks like stiffness. Okay, so what relieves the stiffness? She will tell you when I move around. So this pain, stiffness, relieves when moving around. This means that usually this is a muscular pain. Usually. Stiffness which relieves when moving around. Any pain elsewhere? No. Okay? Okay. Ask her one question as well. How long does it take for the stiffness to wear off or to disappear? She will tell you maybe an hour in the morning. So stiffness arises in 1 hour, okay, which relieves on physical activity. Okay, what is the triad of polymyalgia rheumatica? Pain, stiffness, and limited mobility or limited movement. The triad for polymyalgia rheumatica is pain, stiffness, and limited mobility. So ask her, do you have anything else? Like what, doctor? Do you have any difficulty in movement? She will tell you, yes, doctor, I have difficulty moving my arms, okay, or like lifting my arms over my head or lifting anything. When did it start? How has it started? The same thing. Your differentials here. Polymyalgia rheumatica can be associated with giant cell arthritis. It can be associated with hypothyroidism, and it is a differential diagnosis of rheumatoid arthritis. So again, what are your differentials? Number 1, GCA. Number 2, hypothyroidism. Number 3, rheumatoid arthritis. For the rheumatoid arthritis, I'm going to ask about any redness or swelling. For the GCA, I'm going to ask any headache or jaw pain. For the hypothyroidism, I'm going to ask about cold intolerance. This is very enough. What are the other symptoms that I can ask about apart from the triad? The associating symptoms, we forgot to mention them. Associating symptoms could be when someone is having prolonged pain and stiffness and limited movement. What usually will be affected? Definitely their mood. So you can ask about the mood, and you can ask about any tiredness beside the pain. So mood and tiredness could be the associating symptoms. Okay, move to the past medical history. In the medical conditions, she can give you reflux. Reflux, she's taking omeprazole for it. Why she's having reflux? Okay, actually, it's not that relevant. Some people may claim that the reflux sometimes can be associated with such things, but I'm not sure about it. So usually just assume that the reflux had nothing to do with the polymyalgia rheumatica. Elaborate it, the reflux, when was that, how is it managed, is it controlled, okay? Did you have any endoscopy? Because it's prolonged reflux. So ask her, did you have any endoscopy? Okay, now ask about the lifestyle as well. Guys, I'm giving you the most important points. This doesn't mean that you should not ask about the family history and other things. No, ask about them. But I mean the most important points not to miss. Ask about the lifestyle as well, and how has this affected your life. She will tell you, doctor, I can't walk, I can keep sympathy and empathy all the time. Now, the examinations, the most important examination is musculoskeletal examination to check her muscles and joints, and neurological examination as well. So musculoskeletal and neurological. The examiner will give you findings of proximal myopathy, which means that the patient cannot raise the arm above the head, or the patient can't stand from sitting position. Okay, those are the proximal myopathy findings. I need to do further investigations. Okay, the examiner keeps quiet. Move to the management. From what you told me, you're having a condition we call polymyalgia rheumatica. What is this? Inflammatory condition that causes pain and stiffness and difficulty movement in various parts of the body, usually the muscles around the big joints, like the shoulder and the hip. Why has this happened to me? Autoimmune. What are the autoimmune antibodies here? They are against the muscle. What are you going to do for me? We agree that when someone asks this question, you will say, number 1, we are going to do further investigations. Number 2, the treatment plan. So what are further investigations? Routine bloods, full blood count, liver and kidney and thyroid function test, blood sugar, blood cholesterol. More importantly, ESR and CRP, and antibody tests. Why antibody to rule out other autoimmune conditions like the rheumatoid arthritis? So we are going to do some blood tests to check for a special substance which can be related to other autoimmune problems to exclude them. And you can also do X-ray and MRI around the affected joint. So routine bloods, antibody, number 2, number 3, MRI and X-ray. How are you going to treat me? The treatment here is corticosteroids and some simple painkillers. Okay, okay. We can also give her, beside the corticosteroid, anyone who is taking long-term corticosteroids, we provide number 1, bisphosphonate to avoid osteoporosis. Number 2, PPI, which is already taking. She will tell you, doctor, but I am taking already PPI, or I'm taking PPI. Yes, you will tell her that we need to increase the dose of your PPI because she's taking steroids. So to take steroids, we need to increase the dose of your PPI. So corticosteroids, bisphosphonate, because the corticosteroids cause osteoporosis. And number 3, we can give her simple painkillers, and we can consider methotrexate, anti-inflammatory. Why methotrexate? Or sorry, immunosuppressant. Why methotrexate? Because actually it will reduce the dose of steroids. I mean, long doses, because actually this patient is supposed to have high dose steroids. So to reduce the dose of steroids a little bit, we need to give methotrexate. Okay, so what's next? Doctor, I told you about the GERD. She will ask you about the GERD, what you can do for me. You will increase the dose. She will ask you, doctor, am I going to get worse? Actually, this condition can improve after starting the treatment. However, we will continue on steroids for some further period, up to sometimes it can take you up to 2 years to prevent any relapse. So it will get better after start, but we will continue her on steroids to prevent any relapse. We are going to follow her up. Regular follow-up. Why? To repeat the blood test and to check her compliance with the medication and to adjust her corticosteroids dose. Then she will ask you about the side effects of the steroids. When someone asks you about side effect of steroids, please ask them, may I know, do you have any particular concern in your mind? Otherwise, you'll keep speaking too much about many side effects. So, do you have any particular concern in your mind? Yes, doctor. She will tell you about the bone, the osteoporosis. So now we will tell her that we are going to give you bisphosphonate and calcium and vitamin D. And we are going to give you some lifestyle advice, like what? Keeping mobile. And we can provide you some physiotherapy as well. So medications and physiotherapy and lifestyle. Besides, of course, you can tell her about the peptic ulcer, the hypertension, the risk of diabetes, the weight gain. Those are the other side effects of steroids. If you need to give her warning signs, if you ever have time, you can warn her about signs of GCA and hypothyroidism because they are a strong association with the PMR. This is a full station. So again, treatment will be further investigations, routine bloods and antibodies and X-ray and MRI. The treatment plan will be number 1, you are going to give her high-dose steroids besides some simple painkillers. And you can also, because of the steroids, you will consider giving her bisphosphonate. You can also give her methotrexate, immunosuppressant, to reduce the dose of steroids. She will likely to take steroids for a longer time, up to 2 years, to prevent any relapse. You are going to follow her up regularly to repeat her blood test and her compliance with the steroids as well. And she will ask you about side effects of steroid. Warning signs can be the signs of GCA and hypothyroidism. Why? Because they are strong association with the PMR. This was our session so far for today. Tomorrow, inshallah, we'll resume the ethics station. Very few stations are left, maybe 10 or 11 stations. We can finish them even earlier. That's why I made a surprise to you. I will include psychiatry stations tomorrow, inshallah. That's why you need to study the psychiatry history very well before tomorrow. Okay, anyone needs to leave? It's fine right now. Dr. Masih, are you fine? I think you are not good today.
No, nobody, I'm fine. I think I need to sleep now.
Really? Are you sure that this is the reason?
Yeah, sure. This is the reason.
Yeah, I know. I bet it's far late there.
Yeah, buddy. It's 12:45.
Okay, so
Okay,
so take care and good night. So everyone
okay,
now, everyone can